Good afternoon and welcome virtually to the White House for our National Safe School Reopening Summit. Last September, I had the chance to visit communities to see how educators were handling the challenges of going back to school. And I met a teacher who was coming to his classroom every day, even though his entire class was virtual. When I asked him why, he explained that he wanted his students to see the room, to understand that that space was special because it's a safe place to learn and grow, because it belongs to them, even if they can't be there in person. He told me, what educators really do every day is create community. And I know exactly what he means. I teach English and writing, and at the start of the college semester, my students are often shy and closed up. But as time passes, they share their stories about their lives. They learn and laugh together. They root for each other and take risks. They courageously read their writing out loud, sincere and raw, and sometimes heartbreaking. They trust each other because they know this is our community. Over the last year, educators have done so much to keep that connection alive. But teaching virtually just isn't the same. In my class, students don't chat with each other like they used to, after the lectures are over. I can't read their body language to know when they're struggling. And I have so much admiration for those teaching elementary-aged children who are tired of screens, but don't have the language to articulate why. Or middle school students who are struggling to find their identities, isolated from their friends. Or high school students missing out on the moments that they are supposed to stay with them forever, like prom and championships and class trips. There are some who have questioned whether or not educators want to go back to school. Of course we do. Classrooms are, where our work comes alive. They're where we can truly connect with our students, where we build community. But we have to go back safely. When we passed the American Rescue Plan, we took an enormous step toward that goal. And today, we're going to come together to share solutions for schools across this country. We're here to listen and learn from you. We're going to support you because we know that's the only way our students succeed. But we also know that this isn't going to be easy. My husband made a commitment to you that we would be open and honest about the opportunities and challenges of reopening schools for in-person learning, which is why today is just the beginning. We aren't going to get this right, but we're always going to work with you. We're going to be transparent with you, and we're going to earn your trust, just like you do for your students every day. Recently, I've been touring schools to see what's working and what's not. And I had the chance to visit a school in Concord, New Hampshire. I met some of the kids who are coming in part-time, and I asked this little fifth grader what he had learned, about himself during the pandemic. And you know what he said? He said, I can do stuff that can be hard or difficult. If you're stuck, then keep going. So many educators have felt stuck this year, but we keep going. It's what we've always done. When the classroom budgets run out, when children can't focus because they're worried about their families, when the lesson plans go wrong, we find a way to push past the chaos and build something beautiful. We never stop learning. We never give up on the students who need us. And together, we will rebuild our schools and create the communities our students need. Thank you.
Thank you. Thank you, President Biden, Vice President Harris, Dr. Biden, and Dr. Rochelle Walensky. School districts, leaders, parents, educators, and students, our students who are part of this summit. We learn best from one another. We know that. We know students learn best from students, teachers from teachers, principals from principals, superintendents and state leaders from each other. We know that. That's why we're here today. I'm Miguel Cardona, and I'm honored to serve as the Secretary of Education. I'm not only here as an educator, but as a father of 2 high school students, husband of a family school liaison who visits middle schools daily, and brother to Marisol, a school social worker in Florida. I know how hard this work can be. I want to share quickly a story called There is a Rainbow. It was shared with me by Teresa Trinder. She wrote the book. She's a parent, and her son Charlie had a hard time when we had to go fully remote last year. And it was a very difficult time, as it was for all students across the country. And the students in this neighborhood in New York, they made paintings of rainbows. And they put these paintings on their front doors or on their windows so people in the community could see it, to provide hope. These rainbows provided hope. And at the end of the story, the school doors open and students are able to go back, and Charlie's able to go back to school. So the school is that rainbow. Today, we're going to be talking about rainbows. The National Center for Education Statistics share that over 45% of our elementary and middle schools offer in-person learning daily. About 75%, or 3/4 of our schools, are offering some form of in-person learning, including hybrid. That's a great start. We must continue that so every school, K through 8, offers in-person learning 5 days a week. I want to give a quick shout out to those districts that have really been doing this work well. Shout out to Dallas, Texas, and Michael Hinojosa for your leadership. Arizona, I love the progress you're making, and you know I'm not going to go too far without giving a shout out to Connecticut. Thank you for having the doors open in many places since day one. Thank you for your passion and your urgency. We still have work to do, lots of work to do. You know, we know there are inequities to in-person learning. Only 28% of Black students are going to school in person daily. 33% of Latino students are doing it. And only 15% of our Asian students are going to school in person daily. That's compared to half of white students that are doing it daily throughout our country. And we know students with disabilities lack access, and the effects of the pandemic and remote learning have impacted them so greatly. America, that is our charge, to safely reopen schools as quickly as possible. The American Rescue Plan provides $130 billion to help get this work done. With that money, we can address those inequities that I just talked about. With that, we can safely reopen our schools. And we have to act wisely and with urgency to get it done. As the First Lady mentioned, shout out to the teachers, educators across our country who've fed children, provided that social emotional support, have driven children as bus drivers. You're doing the work. I'm proud of what you're doing. I'm proud of the commitment you're showing. It doesn't take a pandemic for us to appreciate our educators, but I'm really proud. I want to say thank you. And that's what today's about. I want this to be a conversation. Panelists, I want you to be thinking about your audience, are your colleagues at work, your friends. This needs to be a conversation, an authentic conversation where we learn from examples and we learn from mistakes. That's how we're going to learn best, when we're open and we're honest about what's working and what's not working. You know, my experience in Connecticut as a former commissioner of education, one of the things that I learned is partnerships matter. And one of the partnerships that really helped us reopen schools safely was the partnership with the Department of Public Health. Deirdre and her team over there, we work hand in hand. We talk so often about how to do this and how to be transparent, how to make sure that health and safety drive every single decision we make. So I'm honored to introduce the next speaker, who's a partner. And she's going to be speaking now, but at the national stage, we're going to make sure that those partnerships continue. And my partnership with Dr. Rochelle Walensky is going to be strong. So it's my honor now to introduce Dr. Rochelle Walensky, who leads the Center for Disease Control, who has a few remarks. Dr. Walensky?
Thank you so much. I'm so honored to be with you today to join the President, the Vice President, First Lady, and Secretary Cardona, as well as all of the teachers and staff and students virtually here with us today. I want to say a special thanks to Secretary Cardona and the team at the Department of Education. They have been steadfast partners in this critical work. To the school teachers, leaders, staff, and students, I want to share my heartfelt gratitude for your innovation and true resilience over this past year. You have successfully navigated unprecedented challenges in how you teach and how our students learn. As a mother of 3, I too have experienced the challenges and uncertainties within my own family, and it's not easy. My son's back to school night happened right after I was nominated to be the director of the CDC. I heard from his history teacher about how hard it was to engage students on Zoom, and from his other teachers about how hard it was to do biology labs on Zoom. This experience was front and center for me as I took this role at the CDC. But today I'm hopeful because of the opportunity we now have to get our children safely back to in-person learning. The hope is based on real-world experience, evidence, and science. We know the significant benefits the classroom setting and the support services delivered by schools provide to our students, especially to those from low-resourced communities, racial and ethnic minority communities, and those with disabilities. As I have frequently said, CDC believes that schools should be the last place to close and the first place to open. You are so vital to making that happen. And now we have the data, the science, and the resources to make this a reality for all of our schools across this country. Most importantly, your bravery, your creativity, your fortitude represent the real world evidence to show that this is truly possible. In every aspect of responding to the COVID-19 pandemic, science must lead the way. At CDC, before we develop and disseminate any guidance or recommendations, we conduct an in-depth review of all of the data available and evidence. That process was the foundation of our operational strategy for K-12 schools through phased mitigation, released first on February 12th. As we developed the strategy, we also engaged with our educational and public health partners to hear firsthand from parents and teachers about their experiences and their concerns. I personally engaged in roundtables and heard the anxiety expressed by both parents and teachers, anxiety about children's educational milestones lost, and about personal and family safety. Understanding their perspectives was central to crafting a strategy that could be implemented in schools of varying shapes, sizes, and resources across this nation. Ultimately, our strategy was built on the evidence that showed that K-12 schools could safely open for in-person instruction and stay open when they implemented a complementary set of mitigation strategies. A key principle of the strategy we called phased or layered mitigation. We recognize that while all mitigation strategies provide some level of protection, the greatest protection is provided when they are layered or implemented together in the event that one might be broken. This is important because the risks of COVID-19 spread associated with lapses in one strategy, such as breaches and mask wearing, are lessened when there are other mitigation strategies in place. CDC recommends specifically 5 key mitigation strategies: universal and correct mask wearing, physical distancing, hand washing and good respiratory etiquette, cleaning to maintain healthy facilities, and using diagnostic testing and rapid and efficient contact tracing combined with isolation and quarantine in collaboration with our local health departments. In particular, we emphasize the importance of universal masking and physical distancing along with cohorting or using pods to minimize exposure across the school environment. When we released the operational strategy, I stated that CDC would follow the science and would update our guidance quickly as new evidence emerged. In our initial strategy, we recommended that physical distancing should be at least 6 feet between people based on available evidence at the time. And to no one's surprise, we quickly heard that this was a challenge for many schools, given their current physical layout and the number of children in some school communities. Since the initial release, CDC scientists have been actively reviewing the latest science and conducting their own studies to expand the evidence base, including that evidence on physical distancing. We are grateful for them moving so quickly to produce new evidence that we could act upon. Last Friday, in light of a series of studies recently published, CDC updated its recommendation for physical distancing between students in classrooms. Specifically, in elementary schools, CDC now recommends the student remain at least 3 feet apart in classrooms where everyone is wearing a mask, regardless of the level of COVID-19 risk in the community. In middle and high schools, CDC recommends that students remain at least 3 feet apart in classrooms where everyone is wearing a mask and the level of community transmission is low, moderate, or substantial. Because COVID-19 spread is more likely among older students, CDC recommends that middle and high school students remain at least 6 feet apart in communities where COVID-19 risk is high and less cohorting is possible. I want to emphasize that these recommendations are specific to students in classrooms with universal mask wearing. In all other school settings outside the classroom and between students and adults, CDC recommends at least 6 feet of physical distancing. We believe these updated recommendations are another important step to getting our children back to in-person learning. CDC is committed to partnering with you in this effort. Recognizing that recommendations can be complex, CDC has released a series of online resources and tools for schools on our website. And we continue to conduct webinars and stakeholder engagements to increase awareness of the strategy and to support its use in planning efforts for school openings. All of these actions build on our ongoing work to support teachers, school staff, parents, and students, as well as our efforts to provide guidance, tools, and resources, and to our educational partners need to get our nation's schools open as quickly and safely as possible. Last week, CDC announced its plans to invest $10 billion to support COVID-19 diagnostic and screening testing for teachers, staff, and students, an additional mitigation strategy to support safe school reopening. And throughout the month of March, we have been engaging with teachers and school staff to help them get vaccinated through the more than 9,000 pharmacies in our federal retail pharmacy program. Participating pharmacies are now prioritizing vaccination appointments for educators and staff who work in K-12 schools. Encouragingly, one recent study suggested that 50% of our educators had received at least 1 dose. If you have not been vaccinated, I encourage you to go to cdc.gov to learn more about how you can sign up for an appointment through this program. Before I close, I want to acknowledge that the decision to return to in-person learning is not one I take lightly. As a parent, I know this may be one of the hardest decisions you have to make since this pandemic began. My youngest son recently returned to hybrid school about a month ago. Last week, he said to me, "Mom, it finally feels like I'm in school again." I'm so glad he's back. He's looking forward to his high school graduation next year after a year of support of our children who are our future. I look forward to this important dialogue and to learning from you during this entire day together. Thank you.
I'm Kathy Hoffman, Arizona Superintendent of Public Instruction. And while this past year has been incredibly challenging for our education community, I finally feel like there's a light at the end of the tunnel. And with declining COVID cases, teachers getting vaccinated, I am hopeful that by the end of March, almost all of our schools will be open for in-person instruction. And I've already heard about students coming back from their spring breaks, so excited to be back at school, back with their friends and teachers. And I expect that we're going to continue to hear a lot of these happy stories. Although it's still going to look like school during a pandemic, it feels like a weight has been lifted, and I'm very optimistic that our school communities are going to have a very strong end of the school year.
Thank you, and thank you, Dr. Walensky. Your kid will walk the stage next year, and so will mine. We're in this together, and I appreciate your partnership. And thank you for the vaccination and the surveillance testing. We know that's needed. Thank you for your support. I'm really excited to begin our first panel, Implementing CDC's K-12 Operational Strategy to Keep Students, Educators, and Staff Safe. Lessons from the Field. I'm really pleased to welcome our guests from the Cleveland Metropolitan School District. We're joined by Eric Gordon, Chief Executive Officer, Sherry Obrensky, President of the Cleveland Teachers Union, Aaron Creel, Facilities Manager, and Trayvon Edwards, a Cleveland Metropolitan School District graduate and a current district intern. Can you all start by giving us a few minutes about how you approached reopening?
Thank you, Secretary Cardona, for having us today. Really, we focused on three key things in our reopening. The first is being acutely aware of who our community is. We're 86% children and people of color, 100% poverty, and the highest childhood poverty in the country. Many of our families and caregivers are frontline workers working in the healthcare system, which is large in our community, and in restaurants and in cleaning and things that put them at higher risk. And understanding that we have long-standing health disparities that existed before this that provided extra risk, which told us to use a cautious reopening. The second was paying not only attention to physical safety, but to social emotional safety. And that meant not only outfitting our buildings with the right PPE and mitigation strategies, but making it really visible and transparent. And so we videotaped buildings so people could walk through virtually to see what that building might look like. We had school-based safety teams that did virtual, did walks through the school so that they could provide comfort to their colleagues and to their parents and students. Lots of messaging to our community and really investing in some of the extras that maybe weren't absolutely necessary for physical safety, but sent signals of emotional safety as well. And then the third and final was to collaborate. We have 9 labor partners and a principals association, as well as our community that have been engaged every step of the way. Because while it's easier sometimes to go do it yourself, it's more effective in the end to do it together, despite all the wrestling it took to get that done, which has led us here in the last several weeks to open up very, very smoothly as we've returned our students to hybrid learning in Cleveland.
Thank you for that. Thank you for that, Eric. You mentioned wrestling. Listen, this has been hard work. This is the first time we've ever had to do this. So it is different. It forced us to think differently. And one of the things that I want to hear about, and Sherry, this question is for you. How have you worked with the district and the educators to collaborate and to make it work despite this being unprecedented and having to wrestle through it? Tell me about that.
Well, first of all, thanks for having us here today. We appreciate the opportunity. We made a concerted effort from the very beginning to really work together very closely and collaboratively as we dealt with the closing of schools, and then as we were working through being fully remote when schools reopened this fall, and then as we're moving into this hybrid period with getting our students physically back to school. We meet continuously. We have groups that represent different stakeholders within our district coming together to problem solve, to come up with all of the solutions that we have, to do the messy work of talking through the challenges and figuring out how we can get to the other side. And we have really appreciated the collaboration and partnership. I actually came to be the president of the Cleveland Teachers Union at the very beginning of the closure period. I'm just coming up on my 1-year anniversary. And even though I'd been in leadership for a long time, Eric really worked with me and to develop that partnership so that we could lead together throughout this time period, and making sure that the boots on the ground, that we had a voice in how we were doing the work. It was so critical to have the voices of the people who are the boots on the ground, who are lifting the challenges that we see every day, and then helping come up with the solutions that we felt were workable, not only so that we had practical implementation, but also so that we were building that security among the staff to feel that they were equipped to come in and do the difficult work that we had to do.
Great. Thank you so much, Sherry. Eric, this question's for you. Can you talk about how you use CDC's prevention and mitigation strategies to help work towards in-person learning?
Well, Dr. Walensky, you really teed it up nicely talking about the layering strategies that the CDC outlined for schools. We use those as our entry point, and then work very closely both with the Ohio Department of Public Health and here locally, the Cleveland Department of Public Health, to think about what those look like operationalized and locally. We also relied really heavily on our effective professional organizations, the Council of the Great City Schools and Chiefs for Change, who provided us, operationalizing these guidelines. What does it look like? How do you do it? What are the best practices in large urban communities across the country? And together with Sherry, access also American Federation of Teacher Resources. So it was a combination of the science that the CDC provided for us, as well as the practitioner expertise that we were able to quickly assemble and learn together through our networks across the country, that really made us comfortable with the strategies we were implementing.
You've talked so much, Eric, about these partnerships and how key these partnerships are. You have a well-known hospital system in Cleveland, and I'm wondering if you can discuss the partnership you've had with public health in your healthcare community.
Yeah, we're really blessed to have a sizable and important health community here in Cleveland, and all of them willing to help us. We deliberately partnered with University Hospitals, which is a regional research center here in Cleveland, who actually co-developed what they call their school playbook with us. They actually walked with Aaron and Trayvon and others through our buildings, a K-8 school and a high school, and we helped co-design how the building had to be retrofitted in order to be safe for COVID. And then our contribution to their evidence base actually contributed to our regional approach. So our hospital systems were critical, and we were glad to be a small part of influencing the regional approach here as well.
That's just wonderful. For Trayvon, you've vaccinated thousands of staff, 3/4 of your teachers and your principals. So I'm wondering if you can talk to us about the work you've done in the vaccination centers and what that's looked like.
Sure. So first, thank you for having me here on this panel. So before we started vaccinating our staff here, we actually did a walkthrough with our partner, the City of Cleveland, the Department of Health, and the Cleveland Department of Health, to ensure that the clinic had a great flow. So I went over to the public auditorium and gained the logistics of the clinics, again, to ensure that the flow was smooth there. What worked, what did not work, again, mirror the same thing for our staff, iron out what works best for them, and then go ahead and look at our staff and use, again, what worked well there.
That's great.
So I was I'm sorry. So I was the pod lead on the vaccine clinics, and that simply is learning all aspects of the vaccine clinic, except for logistician, of course. And I that's the non-medical roles, overseeing the staff clinics, filling in where it needs to be, where we're short with staff, as breaks, if we're short, filling in there. And the only complaint, I believe, Eric, that we got right was that we moved too quick, because from registration to observation was a rough 10 to 15 minutes.
Amazing.
That's amazing. It's interesting how, for the audience listening, I think what you're hearing are some great examples of what works, but you're also probably hearing things that you're doing in your communities, and it's kind of encouraging to hear, okay, we've done something like that. So thank you for sharing those examples. I'm going to turn a little bit now to Aaron, Facilities Director. unsung heroes sometimes. You know, as a former school principal, let me tell you, the custodian and the secretary knew more about what was going on in that building than I did. So, you know, I'm glad you're on the panel, and I'm glad you're able to share what you've done to make sure that the schools are safely reopened. I read here 15,000 air filters and 900 air purifiers were a part of the solution. Tell us a little bit about what you did to make sure that the schools can reopen safely.
Okay, hello everybody, and thank you for having me on the panel. Let's talk about the ventilation first. You know, our approach to this was to change our filters in our more modern buildings to do more frequent changing, you know, from 2 times a year to 4 times a year. We identified these months, and like you said, we changed over 1,500 filters starting in this past January. We also recognized our older buildings who doesn't have the modern systems that presented such a big challenge to us. And we went out and recognized these buildings, and we identified them and classified them in 2 different categories. In those buildings, in the occupied space, to mitigate this COVID issues, we purchased over 900 air purifiers that we installed in every occupied space in these buildings, and did things like that. We also recognized in our newer buildings, did things that we could do because we have modern systems like building flushes and things like that, which added additional building flushes at night when students and staff leaves and things like that. Also, we approached the building approach with signage. Using COVID signage was a big role in this. From the time you walk into our buildings, we have indicators on the ground, outside signage from the time you hit the door to keep people distanced, to keep us safe. And with UH Hospital, we really walk through the buildings to identify one-way arrows down hallways, to identify two-way traffic, to really keep the staff at a safe distance, stairways that was one way. So signage played a real big role in our approach to these buildings. We also did a lot of spacing. One of the biggest challenge was the spacing of our furniture within our buildings. That was a big challenge. We went about that and did furniture moving. Like we had a lot of excess furniture, so we had to find places to put all this excess furniture. So we utilized storage space. We utilized some of the gymnasium areas. Some buildings we even had to remove some of the furniture and things like that. Once we got done with the signage and the occupancy, we also created a smart sheet to help the academic side, just a starting point, so that they can see what we call as the COVID occupancy, how many students that they can actually fit in their room, to help them, give them just a jump start of what they're dealing with for the kids that's coming back in person. So we also created a signage video for our staff. We have such a large district, so getting this information out was very difficult to a lot of folks, and we created a signage video for staff to go over as we placed the staff. And everybody played a great role. The teachers, principals, they all had a role in helping us finalize our occupancy and spacing in our buildings and things like that. One of our other approaches was PPE. PPE was a big role in our building prep. We have hand sanitizers spread out throughout our building in key locations. We have hand sanitizer and other PPE items staged in every classroom for the teachers to use. We created a 90-day drop shipment program, so all of our buildings will receive their allotment of PPE every 90 days. And as a backup plan, we created stockpiles. We call them stockpile sites, where we have these sites spread out, one on the west side, one on central location, one on the northeast side and the south side, where we have PPE as an emergency so that our staff would never, ever run out of PPE. For any emergency, we have a distribution plan to quickly provide PPE for all of our staff if needed. Those are some of the things and how we approached amongst a lot of things with the help from Mr. Gordon and the teachers and principals. So it was a truly team effort to get to this point.
Aaron, it's extraordinary when you think about the logistics that you've been thinking through. So I'm going to stick this one back with you and say, and I know from my own dinner table that, you know, the flow of students through the school has to change, right? So I'm wondering if you have any key lessons that you can convey to others about how you supported some of the refit configuration of flow of students.
Yeah, so as a facility person, and like I said, we really collaborated with the building staff, teachers and principals, because our buildings are so different. They're made so different. We have them all kind of different sizes. The logistics of them are so different. So the key was to communicate with the building staff, get their approach, because they're the ones that have to deal with the flow. And then once we got their ideas and how they wanted the kids, then we sprung into action with our signage. Like I said, we have one-way signage that tells you, I mean, from the beginning of school, from entering the front door all the way to the classroom, we have indicators as to which side of the hallway you stay on, which one-way stairway. Some stairways are two ways, and we indicate that with our arrows and signage and things like that. We even have bathroom usage that was signed, and stalls and sinks that was identified that we couldn't use. Another big thing is lunch now. Lunch is now in our classrooms, some in cafeteria, but the majority of our kids will be eating in our classrooms. So that was a big change for us. And so we figure out a program how to support that. We also, on the facility side, to help our staff, we changed our staffing hours. You know, we have our environmental specialists coming in a little earlier now to help our staff with the sanitation duties during the day. And we save time at night to do our general cleaning and our final sanitizing before we leave the building at night. So a lot of this was collaborating with the principals and teachers, and we went on their guidelines, and we really got a lot of information from them. So to really answer your question, you really have to work together to get this done.
That's impressive. Aaron, you know, I just want to tell you publicly with the world watching, thank you. You know, I can come up here and talk about school reopening. It's people like you that make it possible. Your actions, everything you just talked about, are why our kids and our educators are safe. That's huge. 1 year and 1 week ago, we didn't know what was coming. We didn't know the extent to which it was going to affect our lives. Your job changed totally. And
Yes,
just
that
to
is
hear
correct.
just to hear you talk and with confidence about what you did, that's exactly what we need to hear across the country, how these things are happening with people like you who are leading the way, man. I'm so proud. Thank you for your work. Thank you. So Eric, I want to turn to you now. We know during this pandemic, many families chose to keep their children home and learn in a virtual environment for various reasons. And as a leader, you're going to have to make sure that you're providing great education for all students, whether they're in person or learning remotely. How did you balance that challenge to provide learning for all students, whether they're remote or in the classroom?
Yeah, so one of the things I'm most proud of our work in Cleveland is from the very beginning, we were committed that every child was going to have direct instruction from their classroom teacher 4 full days a week, and then using Wednesdays as an asynchronous day, like many other districts. What's different about it is many other districts didn't have full interaction 4 days a week. They often used other things like taped lessons, much more asynchronous work. And so when we moved to reopening in hybrid, that was still our commitment. And we were looking at data that was saying as many as half of our students weren't going to return. The dirty little secret is that as hard as closing was, opening is harder. And so we've had to figure out, how do we keep kids connected to the teacher that they've had and still provide that 4 days of instruction that we committed to, whether the child came back or not. And so with CTU, we work very collaboratively to design teacher teams where maybe Sherry and I have 2 classes, but now we're going to share those classes so that I may not see my children every day for 4 days, but I still see them 2 days of the week, and Sherry's seeing them the other 2. We actually even broadened those teams sometime to add a 3rd person that was involved. If we had to do assignment changes, we did them within the school, and we tried to provide as much capacity for those reassignments. And we're still working through that because our families are still changing or shifting their decisions in the moment. You know, we've committed to ourselves that we're not successful if 37,000 students have a generally positive response. we will be successful when 37,000 individual students each had a successful response. So we've called a reopening a transition, and we brought students back in phases, including this week, our final phase, so that we can work through these things with our community, which has been extremely resilient, showing high levels of grace, so that we can get every individual student experience right.
That is so very important, Eric. And you know, you talk about individuals, and there are so many individuals that have been particularly hard hit by this. Students with disabilities, students experiencing homelessness, and many, many other challenges. So Sherry, this one is for you. I'm wondering how you've reached out, how you've been able to support those families, those students with really specific, intense challenges.
Well, I think one of the things that we have done throughout the pandemic period is that our teachers and other educators have made special efforts to connect with families. I think that our connection with families is much stronger than it ever has been, in terms of our teachers in the remote space, online, talking to parents and students every single day, and really getting to know the families and understand the challenges. And then as we were working on returning in person, prioritizing those students with the highest needs and making sure that we were returning them first, and also providing them with more time in person. So our students with the highest needs are coming 4 days a week, and are in person 4 days a week, as opposed to the 2 days in person and 2 days remote. So that was one way that we were working on making sure that our students that have the most severe challenges are getting the most attention in person. Additionally, we have been a district for a long time that has focused on social emotional learning. And so creating additional training opportunities for teachers as we're returning into this in-person space as to how we address social emotional learning in the time that we are now with the challenges that we have now, so that we can be more effective in person and in implementing those strategies in our classrooms. But like I said, SEL has been a priority in Cleveland for a long time, and we've done that work for a long time. So this is just enhancing that work, brushing up on some of those in-person skills and making sure that we're being cognizant of that when we're in the classroom with our kids. And we know that this is going to be a process. This is going to take some time. We didn't get into, this pandemic crisis overnight, and we're not going to emerge from it overnight. We are going to have to continue working together, plugging away, making sure that we're meeting our kids where they are and getting them where they need to be.
That's great. Thank you very much. I think that was you captured so much of what we wanted people to hear. We only have a couple minutes left, so Dr. Walensky, could you take the last question?
Sure. So I'm just curious from each of you, what one piece of advice you have for all of the districts out there that are striving to get to where you are. What piece of advice would you offer for them?
I'll go first. I'll jump in. So I think from my perspective, the best advice that I can give is that it's really important to bring all voices to the table and continue to work together, even though the work is messy and difficult. And sometimes you're not crazy about everybody that's sitting around the table. You get angry with each other, and it's tough, but it's so worth it on the other side when you are working together, doing this difficult work to get to a place where you know you're doing a great job for kids and their families.
Eric, do you want to go next?
Thank you very much to all of you for your participation. You were amazing. I know we have a couple others that are going to add. So share with us briefly, what were those things that you want us to know?
Trayvon, looks like you're going to weigh in here.
Yes, so with such large district, I believe that communication is key for any organization, that is. And all team members, no matter position, put 115% in and keep the students in the forefront. If that is the case, then I believe that success will fall right in your lap.
I think Trayvon probably said it best for all of us.
Mhm. And I would like to add to be flexible. You know, as facility guys, we are so routine regiment, and this was all new for us. And being flexible was very key. You know, it was a lot of changing, and for facility guys, that was difficult, but we did it. And everybody, for the most part, I'm so proud of CMSD, was very flexible.
I want to just thank this extraordinary panel from Cleveland for all the work you've done, for the example you've demonstrated, and for teaching us how we can get to where you are. So thank you very much. We'll continue our conversation in a moment.
I'm Viola Garcia, Aldine School Board member and NSBA president-elect. Of course, school board members want to safely reopen schools in person as soon as possible. With guidance from the CDC and collaboration with health officials, local city and county governments, one by one, schools will reopen to in-person instruction. We've been listening and will continue to listen to our local communities, students, parents, teachers, and staff, and all the affected in buildings, on buses, and all related school activities. We need the resources to undertake mitigation measures to reopen safely, to protect students or their families and employees when they get home from work. The social, emotional, and health concerns and sense of security for all are our primary focus as we reopen. These decisions must be made in consultation with school boards, teachers, parents, community members, and health experts. This work calls for all stakeholders to be included.
Well,
Good.
I'll tell you later.
John, I'm Michael.
Hi, thank you, Cleveland. That was amazing. And now I'm excited to hear from the New York City School Chancellors, Misha Ross Porter, UFT President Michael Mulgrew, Principal Amy Hom, and 11th grade student John Kandwa. But before we start, Chancellor, let me first say, I am inspired by your story as a student, a teacher, principal, an executive superintendent, and now the first African-American woman to lead the country's largest school district. Born in Queens and working in Bronx, really, really proud of you. I want to hear a little bit about you and how you made this transition during the middle of a pandemic to reopen schools. Can you share a little bit?
Absolutely. Well, first of all, thank you so much, Secretary Cardona. And I have to tell you, I am equally inspired by your story and your journey, and being in this club of first is an absolute honor and privilege. You know, I've had the honor and privilege of working over 20 years in the Department of Education, as you said, in all of those roles. But, you know, what is super important about that work is I started as a youth organizer in the Bronx and was a part of an amazing team that had the opportunity of young people when we were 17, 18, and 19 years old to plan a school. And so it gave us a great opportunity to learn what possibilities and potentials existed for all of us. And so growing up in this Department of Education and now landing in this seat as Chancellor, I'm deeply honored to be here and excited to be here today with you and all of my partners in this work. Michael Mulgrew from the UFT, we've worked so very closely together to make school reopening happen, and we are going to continue to work together as we move into next year. I'm also joined today by Principal Amy Hom of PS1, Alfred E. Smith in Manhattan, and 11th grader John Kandwa from the High School for Teaching and the Professions in the Bronx. And it's critical that these partners are here today because they have personal experiences with schools reopening, and their voices are invaluable as we have conversations around what has worked and what we need to improve upon. The true story I have to tell you of New York's reopening is not one that I can tell alone. It's a collaboration between the DOE, between principals, between teachers, students, parents, school staff, and of course, community partners. It was not a lone effort by the DOE. Instead, it was the highest priority for many public agencies in the city to come together around school reopening. And so we did that. We came together, leveraged our areas of expertise to reimagine our schools from top to bottom. We're proud of the work we've done. I'm proud of the work we've done. A principal, I'm proud as a parent, and I'm equally proud as the Chancellor. And we know, I know, especially how lucky we are to be in the city with the vast resources that we have that could allow us to do this. And I couldn't do it without the commitment of partners like Michael Mulgrew to make this happen. So thank you so much, Secretary Cardona, for having me today. And thank you for allowing me to bring my team forward who will help us to really do this work.
Thank you so much, Chancellor, and how inspiring. CDC last month put out our operational roadmap for getting schools reopened. There was a map of mitigation and prevention strategies, and I'm wondering how you took that roadmap, those prevention strategies, and used them to get your students back to school. What in particular worked well?
So first of all, what we did was we made a priority to focus on health and safety. And we really used a multi-layered approach to safety. There's not just one thing that makes our schools safe, it's a number of different measures. We combined social distancing with universal mask usage, proper hygiene, worked on improved ventilation. I had the pleasure in my prior role as executive superintendent of the Bronx to walk through a building with Michael Mulgrew and look at the ventilation. And I have to tell you, my high school training at Queens Vocational as a plumber really helped me in that walkthrough. We also engaged in weekly testing in every single school, 20% of our community. And so we centered our reopening on those health and safety measures that we do. Number one, help our families and staff feel safe about coming into the building, but also keep our community health and safety.
Great, thank you. This next question is for UFT President Michael Mulgrew. Thanks for being here. I want to hear, how do you work together? How'd you get all the different voices to the table to make sure that you're representing such a large district? How did you get those key voices around New York City to craft a reopening plan? I want to hear what worked well, but also, please, the audience wants to know what didn't work well and how did you readjust as you went along?
First, thank you for having us here today. We're very proud of the work we've done in New York City, especially opening up in September. That was a goal we had early. But the biggest problems we had in the beginning were New York City was hit so hard so quickly that as we started to plan for reopening, we were facing the reality that more and more of our school-based staff was dying. So it was really tough for us. We knew we had to focus on the anxiety and fear that so many people were facing at that point in time. While we were doing our work in July, New York City was getting close to 30,000 people who had died. So this was a real strategic piece to have to realize that you had to deal with this. And so it was transparency and safety at all times being clear. We would have town halls at times with 20 to 30,000 school-based staff and members on it, talking about the things that we knew we were going to need to have an understanding of, bringing in independent medical experts, and then having really tough conversations with the city, with different agencies inside of the city. But there was always the goal to get our school system open. You know, as a teacher for 12 years running an at-risk program in Brooklyn, everybody who walks into a school building wants to help children, and that's their passion. So we had to take that and use that as our guiding force as we went through. And working with the principals, we kept bringing people together. I don't think how many people understood that every Thursday for 3 months, there was a meeting in person in a very large place between the principals union, our phenomenal partners at DOE, and all the school construction people, and at times all different medical experts all came in, and the layered mitigation that you spoke about were things that we had put in place before we opened in September. But it was tough, and let me tell you, fear and anxiety is a big deal to have to overcome. But it was always the focus on, we know what's in the best interest of children. We don't like remote learning. We don't like virtual learning. We know it has to be there because of the situation. I want to be clear, we don't like it. It's much harder.
You know, I appreciate that. I appreciate that. You said something there that I really just want to lift up a little bit before Dr. Walensky takes the next question. You said you were monitoring the COVID spread and adjusting based on the spread. Like, decisions are made based on health and safety first. And while your plan was aggressive, you had to recognize the reality that was happening in New York City at the time. And I just think that's critically important across the country. Always health and safety first. And you kind of showed that while your plan was to do something, COVID had other plans. And until that was addressed, you couldn't move forward. So thanks for bringing that out too.
Yeah.
I think that's spot on, the need to pivot and to be flexible in the context of changing landscape in the spirit of safety. Chancellor, this one I'm going to send back to you if you don't mind. You spoke a bit about your evaluation of facilities, and I know you spent a lot of time looking at facilities, doing walkthroughs, thinking about ventilation as part of your reopening strategy. So I'm wondering, for people who haven't tackled this yet, how did you first approach, how did you think through, where did you start in terms of ventilation and facilities?
Well, I like to liken that I started way back in the 90s in the plumbing shop at Queens Vocational High School. I didn't know it was really preparing me for my future in education. But we started thinking about ventilation in March of last year. That was, to Michael's point about where the pandemic was, that was the question of the hour, right? Do we have proper ventilation in our buildings, and can we get there? And we began by surveying buildings and incorporating the CDC guidance early on. Before schools opened, we had to make sure every single room used by students had functioning ventilation. Every room was inspected multiple times. I walked buildings with Michael, I walked buildings with principals, I walked buildings with custodians. It was also really important for people to know that we were, and at that time I was the executive superintendent of the Bronx, but it was important for people to know the leadership was willing to walk through the buildings to make sure that they were safe. And in partnership with the UFT, we were able to upgrade filters in buildings, installed HEPA air purifiers, made repairs to HVAC systems. I think that our custodians were so excited about what we were doing to build the ventilation systems in all of our buildings. And it cost a lot of money. It cost about $31 million to do all of this work. But, we hear over and over again that this is an important health and safety measure. And so making sure that we have proper ventilation in every single building is critical. And I want to just, again, shout out Michael for his work, not only with me in the Bronx, at Lehman High School, but also on the MLK campus, because we would not have been able to get the work done that we needed to do in our buildings without strong partnerships and without the work of also the School Construction Authority.
That's fantastic. And
thank you, Misha.
Chancellor, I appreciate your shout out to your technical experience. We're gonna have to do a summit in the future on technical education and how we're gonna move that forward, and we might give you a ring. I want to turn it now to Amy, school principal. That's the best job, school principals. And I can tell you're a school principal because all those great books you have right behind you. Let's talk a little bit about mask wearing and students, and how do you get students to keep their mask on and to develop good practices to make sure that we're maintaining health and safety as the #1 priority. What are some of the strategies that you did as principal?
From the beginning, we've been very transparent with our community. Just as the Chancellor had just said, that safety, health, and welfare of our staff and children is priority. So we also talk to our staff about being the examples, because they're the adults. So they have to keep their mask on. In the summer, knowing that we'll be returning to school, we've held workshops for our pre-K and K students because they're the most vulnerable. Could you imagine your 4-year-old coming to school and the teacher's wearing masks, PPE, all covered up? So we ran a few workshops over the summer with the families. We took pictures of ourselves with masks, without masks on, so they knew how we would look like and what it would be like in school. We've also, as children were coming into the building, to make sure their masks fit their face. So if they're comfortable and there's some level of comfort, the mask will stay on. We've also bribed, I'm not afraid to say that. We've had stickers, we have candy, we have decorations, whatever it needs to keep those masks on. And the one important thing that we've been able to do too, and safely, is to have mask breaks for the children and just give them time so this thing is not covering their face at all.
Those are some great strategies. So some great strategies that you have to do to get them to understand why it's important. I'm going to switch it over to John. John, you're an 11th grader. We've been talking a lot about the what and how we're going to do things, but John, you're the why. You're the why. You're the reason why we're doing this. We want you and all students across the country to be able to enjoy those experiences. As the First Lady said, as a junior, I have a junior at home. You're the reason why we're doing what we're doing. But tell me a little bit about the masks and how do how do students, what role do they have in ensuring that mask wearing is something that happens? I know in high school, getting students to wear masks might be a little bit different than elementary schools. What are your thoughts on that?
Honestly, for me, I believe that we know that masks are important. Thank you so much, Secretary Cardona, Dr. Walensky, and thank you to the Chancellor for having me to share my story and things like that. We all know that masks are essential. Every day I see Dr. Walensky on the news, Dr. Fauci, and they tell us every day masks are essential and they're important for us to be able to go to places safely. And I want to shout out my Principal McLaren, for always being consistent with us and telling us that we know that we have to wear masks. Like, it's no joke when it comes to COVID. So wearing a mask everywhere we are, the hallways, one ways, two ways, making sure that there's social distance in the classroom, and then also to have us spaced out in the classroom with our computers to make sure that not only we're learning, but the students that are not in the classroom with us are also learning as well. So that's also been an important experience for me. I just want to say that masks are essential, even if it's not in school, but especially in school, masks are very essential. So stay strong, wear a mask, and be safe.
Wow, that was great. You gave a shout out to your principal, to Dr. Fauci. We're going to have to get you in DC soon. Thank you, John.
I was just going to say you can join back next to me in the news. Thank you, John, for setting this example for all of your colleagues and all of your peers. This is going to be our last question. You all have set an extraordinary example. And so I guess my question to you is, what's the piece of advice you have for others?
Oh, I'll jump in. In the end, it comes down to the people at the school building. You have to have faith in them, no matter what guidelines anyone sets. If it's us, if it's you, if it's a state level, you just have to be transparent with the guidelines, and then you have to have faith in the people at the building. We trained over 3,000 what we call COVID building response team leaders for each building, and it really came down to them and us being responsible, flexible, and supportive of them. In the end, education is always about the people in the building and the classroom. That's why we all do this, so that they can work with John and all of our other phenomenal students.
I'll also jump in. I would like to say that one advice I would give is that teachers, students, reach out to each other, because not only is COVID impacting our learning, but mental health as well. I've been talking to my CSAT group, is the Chancellor's Student Advisory Council, and we've really been talking about how mental health is become a forefront of student engagement and things like that. So just reaching out, checking on students, checking on each other, making sure that we're good and that we're continuing to learn and being in our safe space so that we can all be able to get through this together.
I think maybe we'll close there as the statement is about looking out for one another. And so I just really want to thank you all for joining us. This will conclude our panel today. I really enjoyed hearing from all of you. You've taught me the lessons learned that we need to do to get our schools back open. I want to thank the panelists today, and I want to thank you, Secretary Cardona, for hosting this amazing summit and for being just an incredible partner as we get our students and teachers back to school. Thank you.
Thank you
Hello,
for
I'm
having
Frank
us.
Henderson Jr. I serve as Secretary Treasurer of the National School Board Association and a school board member of USD 345 in Topeka, Kansas. One aspect of the pandemic that I say really illuminated some of the inequities in our system was absolutely critical, because transitioning to a remote learning environment, it was much more challenging in more of our high density areas, our larger districts. Some needed to provide devices for learning. Others needed to provide Wi-Fi access, because many households did not have an adequate Wi-Fi system. And it required many districts to partner with internet providers, partner with libraries, use of public facilities. But overall, I commend school board members from across the nation who have carried this load and provided for our students to the greatest extent possible within our funding limitations.
Thank you, New York. Thank you, Cleveland. Thank you, Dr. Walensky. This was amazing. I hope the audience that was listening was able to pick up some strategies that we heard, but also reinforce some of the strategies that you're already doing. This is hard work. And this is hard work. We heard some great examples. Some of the things that I heard, and I was pleased to hear about the ventilation upgrades, and from Aaron earlier to talk about how they did that. The American Rescue Plan provides funds now for districts to do that. So I'm really pleased to hear examples of that. A couple other things that I heard that are really important. You know, there were technical strategies, but they were embraced in a culture of collaboration, a culture of trust, and student-centeredness. That was pervasive throughout both of the presentations. Students at the center of the conversation. It was nice to hear from John. John did a great job representing New York, but students across the country who want to be in school safely. Another thing that stood out to me, relationships matter. You know, it's not always going to be perfect, especially during a pandemic. And you may not agree all the time, but relationships matter. At the end of the day, this is a people business. And we have to remember that relationships matter. You can't get through this by leading through memos. So there was a lot of conversation, a lot of dialogue, and a lot of working together. And I know that when we're past this pandemic, that's just going to lead to better outcomes for our students, because we're going to continue that culture of collaboration, trust, and respect. Trayvon reminded us 115%, because 100% is not enough. So that's really important, communication and flexibility. Thank you so much to those panelists. I'm really excited about what was shared and about the opportunities that our districts have across the country to implement some of these strategies that we heard today. I want to turn it over to my ED and CDC colleagues to discuss our reopening guidance and answer some very common questions. I'll turn it over to them now.
Great, thank you. Welcome to our discussion, implementing CDC's guidance to keep students, educators, and staff safe. I'm Jessica Kardashian, Deputy Assistant Secretary in the Office of Planning, Evaluation, and Policy Development at the Department of Education. And I'm honored to be joined by Dr. Greta Massetti, who leads the CDC's Community Interventions and Critical Populations Task Force, part of CDC's COVID-19 response. And when Greta is not supporting the CDC's COVID work, she is branch chief of the Field Epidemiology and Prevention Branch in the Division of Violence Prevention at CDC. Also joined by my colleague, Donna Harris-Akins, Senior Advisor for Policy and Planning in the Office of the Secretary at the Department of Education. Donna previously served as Senior Director for Education Policy and Practice at the National Education Association. And prior to joining NEA, Donna served in leadership roles for the Service Employees International Union and Advanced CTE as well. So thank you, Greta and Donna, for joining. And I would like to begin by asking each of you to provide a brief overview of CDC guidance and ed guidance, and then we'll ask a few questions for discussion. I know we want to use this time to share information with districts, answer common questions that have come up, and clear up any misconceptions regarding the guidance. So Greta, we will begin with you, and would love if you could provide a brief overview of CDC guidance.
Great. Thank you so much, Jessica, and thank you for that introduction. I'm so delighted to be here. As we've talked a lot in the past several months, you know, CDC really leads with the science, and that's where it starts for us. And what we have seen from data and evidence, it suggests that many kindergarten through grade 12 schools that have strictly implemented prevention strategies have been able to safely reopen for in-person instruction and remain open. And we just heard some amazing examples of leaders in education that are finding the path to doing so. As a first step to support getting students safely back in the classroom, on February 12th, 2021, CDC issued an operational strategy for K-12 schools through phased mitigation. And then the Education Department released Volume 1 of their COVID-19 handbook. CDC's K-12 operational strategy presents a pathway for schools to provide in-person instruction safely through consistent use of prevention strategies, including universal and correct use of masks and physical distancing. Both the CDC and the Department of Education documents focus on layering comprehensively using 5 key science-based strategies that mitigate COVID-19 transmission in schools. That includes universal and correct wearing of masks by all people in the school building, physical distancing, hand washing and respiratory etiquette, cleaning and maintaining healthy facilities, which includes ventilation improvements in buildings,
and contact tracing in combination with isolation and quarantine in collaboration with health departments. And this includes diagnostic testing or referrals to diagnostic testing for people who have symptoms. Of these strategies, we encourage that schools to prioritize universal and correct wearing of masks and physical distancing. We also recommend that COVID-19 screening, testing, and vaccination for educators and school staff can be layered as additional mitigation strategies. Last week, the Department of Health and Human Services announced that CDCs will provide $10 billion in American Rescue Plan funding to states to support COVID-19 screening testing in K-12 schools. And on March 2nd, the president has directed all 50 states and territories to prioritize teachers, childcare workers, and other school staff for vaccination. He challenged all vaccine providers across the country to ensure these educators and staff will receive their first shot by the end of the month. The CDC operational strategy also emphasizes using indicators of community transmission to assess the burden of disease in the community. The higher the level of community transmission, the more likely that SARS-CoV-2 will be introduced into the school facility from the community, which could lead to in-school transmission if layered prevention strategies are not in use. The first volume of the Department of Education's handbook provides implementation recommendations to help schools and educators easily understand and operationalize the prevention strategies in an equitable manner, and shares examples from schools that have been implementing these strategies successfully. We also highlight examples of approaches schools and districts are taking, including district examples that promote safe in-person learning. Now I'm going to turn it back to you, Jessica.
Great, thank you, Greta, and a perfect segue into Donna. Donna, can you please share with the audience a bit more about what's in the Department of Education's guidance?
Absolutely, and thank you, Jessica. So in the first volume of the department's handbook, which was also released on February 12th, our goal was to supplement the CDC's operational strategy with practical examples and roadmaps from schools all across the country that have already implemented these strategies successfully. We wanted to give educators and schools the tools that they need to help safely reopen and stay open for in-person learning, and to implement the recommended mitigation strategies in an equitable manner. We also highlight examples of collaborative approaches that schools and districts are taking, including examples that promote safe in-person learning. And you already heard some of those examples in the previous panels. So volume 1 of the handbook also emphasizes the importance of inclusive local stakeholder engagement, using strategies like surveys, virtual town halls, individual outreach, and some of the other things that you heard from our prior panelists. We know that effective outreach includes all school stakeholders, and in a manner that actually overcomes any barriers that could prevent particular groups from sharing their input. For example, consider outreach in multiple languages so that all parents can engage and all students can engage, and in alternative formats if necessary to facilitate the effective communication for individuals with disabilities. We also know that information can also be provided in partnership with trusted community-based organizations that already have a very strong relationship with families in the community. And it's important to note that this engagement and collaboration should not end once a school actually reopens. The kind of open and ongoing communications that we're talking about are key because education leaders will need to continually use locally collected health data, for example, and communicate transparently with stakeholders and with communities, including determining whether different subgroups of historically underserved students are actually participating in person and in proportion to their enrollment in the school, and keeping an eye on those kinds of pieces of equity data. So families may also have concerns about sending their child to school for different reasons that would also need to be addressed. We have seen the disproportionate impact of COVID on communities of color since the pandemic started, and that may raise additional concerns for students, families, and educators. And while school districts should always conduct ongoing, active, and specific outreach to members of the school community and work to address their concerns, we know you've heard from the beginning of the summit that trust is a key component of any reopening plan. And schools and districts must intentionally cultivate it with communities as they make decisions about how and when to reopen for in-person learning, and how to keep them open as local context changes. Our first volume that came out in February also highlighted implementation strategies for meeting the needs of underserved students during in-person learning. For example, educators and students can wear masks that include a clear panel that could be particularly beneficial for students or educators who are deaf or hard of hearing, or for emerging readers, or for students with speech disabilities, or for English learners. And schools should offer those masks to students who are unable to afford them or who forget to bring them on a particular day. We also know that one way to support physical distancing and smaller student subgroups is by using cohorting or podding. And as schools think about how to design those cohorts or pods, you should ensure that the groupings of those students do not result in grouping them by perceived ability or in ways that perpetuate tracking. Again, keeping equity in the forefront. They should also be designed to support inclusion for English learners, students with disabilities, and other historically underserved students, as required by the civil rights laws, and in ways that don't prevent students from accessing key coursework, including advanced courses in the upper grades that prepare students for specific and particular post-secondary opportunities. And in closing, we want to thank all of you who have submitted suggestions and examples so far to help inform our next volume, which will be released next month. We'll cover even more topics in reopening, like access to food, summer enrichment and learning, academic interventions, social emotional supports, and mental health. So thank you, and back to you, Jessica.
Thank you, Donna. A lot of really important points to unpack. So thank you both. We're going to spend some time getting into a bit more detail on how schools can develop a safe school reopening strategy and what the guidance CDC and Ed have put out actually means for schools, teachers, staff, and students. We've gotten a lot of questions since their release, so we'll try and get through as many as possible. So Greta, we'll begin with you. We know there've been a lot of questions about exactly how much physical distance is needed, and CDC has been conducting and analyzing studies of US schools in real time. Can you please share the latest on how schools and districts should approach physical distancing and why the guidance was updated? And what does this change mean for the importance of other mitigation strategies included in the guidance?
Okay. So over the last 12 months, CDC has been very closely following the science and the studies that have been done in schools. And since the release of the strategy, several new studies were released that added to the body of evidence on the effectiveness of different prevention strategies in schools to maintain low in-school transmission. And that includes 3 new studies that were released through CDC's MMWR, that were just released on last Friday, that basically continue to add to the evidence that schools that have been doing full in-person instruction, many of them using less than 6 feet of physical distancing, were able to maintain low spread in schools while relying on strict implementation of a variety of mitigation strategies done comprehensively and together. So based on that evidence, last Friday, CDC updated our guidance to allow schools to consider using less than 6 feet in classroom. So our recommendations at this time suggest that schools may be able to deliver safely in-person instruction using 3 feet between students in classrooms. We also provide additional guidance on areas or settings that may have higher risk of transmission and where a larger distance is required. And that includes the distance between teachers and other adults in the building, and between teachers and students. We still recommend 6 feet for those settings. We also recommend 6 feet in common areas, and whenever mask wearing is not possible, such as during meal times, or when increased escalation occurs, like when singing or shouting or doing sports or physical activity. So this update really is intended to provide schools the specific tools to understand when is physical distancing a larger distance required and when is a smaller distance safe.
Thanks, Greta. And a few quick follow-up questions. Advice on how schools can best implement testing.
So there's 2 components or 2 potential approaches to testing. And the first is that we recommend that all schools should have a plan for diagnostic testing. And what that means is all schools should know if someone has symptoms at school, it could be a teacher, it could be a staff member, it could be a student, do they have a place they can refer the individual for testing? And it could be that individual's provider or a local public health clinic. So that's the diagnostic testing component. There are many schools that also choose to implement screening testing, and that is where there's a regular plan for testing and doing generally rapid screening testing for individuals. It could be a random sample of either teachers or teachers and students. When prioritizing testing, we recommend that schools prioritize teachers and staff first, then high school students and middle school students, then elementary school students.
Another one of the mitigation strategies is on cleaning. We've gotten some questions around what are suggestions for quickly, efficiently, and effectively cleaning a school?
So generally what schools are recommended to do is to what we call regular cleaning of high touch surfaces. That's those areas that are likely to be touched a number of times by different individuals throughout the day. Things like light switches and the tops of desks and door handles. That type of cleaning, a good wipe down is really the most effective strategy that schools can use.
Thank you. Donna, can you share a bit more about how schools, districts, and communities can approach communication and contact tracing?
Sure. So just touching on a couple of other points that I mentioned earlier, open and ongoing communication with stakeholders is critical here. Not just with your local health department and folks in the health community in general, but with educators inside of your system and with families. So if you have a plan that covers all sorts of conditions, contact tracing should be a part of that, and making sure that you've identified a person or people inside of every school who is responsible for the connections to contact tracing and making sure that it's part of the larger plan for the district and then for the community. So it is all about making sure that those conversations preferably happen up front before there's an incident. But certainly as people are working through ever-changing context and ever-changing, health data, it's critically important to stay close and collaborate with your health partners, or for school districts to collaborate with your health partners in the community, and making sure that you're actually working inside of your school and inside of your district community as well to make sure that all of those dots are connecting and making sure everyone not only feels like, but actually is a part of developing that plan and actually implementing the plan, and making sure that adjustments are made along the way if context changes or recommendations change, to make sure that the plan stays updated and everyone stays informed of what those changes are and how they will be implemented in your school and in your district.
Thank you, Donna, really helpful. Another area we get a lot of questions on is around ventilation systems and what are some ways to improve ventilation in schools. So Greta, any recommendations for the audience on that topic?
And I apologize, but my internet blinked. Could you repeat the question?
Ventilation. So getting a lot of questions about how we can improve ventilation systems. So would love your thoughts on that.
Great. So kind of the bottom line recommendation is that air exchange is essential. So that's what ventilation is all about. And there's a variety of strategies that schools could use. Oftentimes a combination is what it needs to do to get that air exchange. Some strategies involve bringing in outdoor air, and that could include cracking windows open whenever possible and as soon as if it is safe to do so. Ensuring that HVAC systems are, the settings are set to maximize ventilation. So obviously the facilities managers and experts in this area can help guide kind of deciding how to make those settings changes. Increasing filtration, and this includes both changing filters. We heard from the Cleveland schools earlier how they created a more frequent schedule for changing those filters, making sure they fit right. Using exhaust fans in restrooms and kitchens, and other types of strategies like including HEPA filters in classrooms. It's a good way to kind of think about all of the different ways to change that air flow within every classroom and every room in a building.
Thank you. Lots of really helpful ideas. Donna, what are recommendations for how schools can encourage proper hand washing and respiratory etiquette, and how they can build these into their school and classroom routines?
Thanks for that question. We're actually seeing some interesting things there. I recently saw last week a playlist that a music teacher had put together for the length of time, which is about 20 seconds, for hand washing. So, reinforcing those kinds of things throughout the day, whether it's through the announcements at the morning, or perhaps as students are going to or from lunch or from recess, just as reminders, so everyone starts to not only starts, but continues to have healthy hygiene behaviors, covering coughs and sneezes, washing hands after you blow your nose, making sure that there are adequate supplies in the school building to make sure that the supply of soap and tissues, face masks, trash cans perhaps that don't have, where you don't have to touch them, it has a foot pedal, things like that I know people are looking at already. But making sure that those are actually part of the system and not just something that an individual person has to remember. So it could be signage, again, morning announcements or afternoon announcements, or just as students and staff are moving throughout the building, just as reminders for people to continue to stay safe and remember the etiquette around hand washing and respiratory hygiene.
Really helpful, Donna. Thank you. Greta, another question that's come in is, how can schools reopen safely if teachers and school staff are not all vaccinated?
We definitely want to encourage all teachers, all educators, all school staff to access vaccination as soon as it is available to them. And I think with March being Educator Vaccination Month, we really are excited to see how many educators have been able to access vaccination. It's great to see the numbers go up every day. Nonetheless, we know that there are, it's only one component of effective prevention of COVID-19 in schools. And we really want to emphasize continuing to rely on those key prevention strategies. One of the reasons being that only people ages 16 and older can access vaccination. We don't yet have an emergency use approval for people younger than 16. So at this time, we still encourage schools to use prevention, relying on universal masking, physical distancing, and all of those key prevention strategies. And we know that when schools have been putting together that package of interventions, they've been able to safely provide in-person instruction in their buildings.
Thank you, Greta. So Donna, there's a lot in the guidance, the Department of Ed's guidance document. Can you share a bit more about approaches and examples that should be front and center as schools reopen? So we have many districts with us here today that we've been hearing from. Are there other examples of approaches and strategies in the guidance that might be helpful to districts as they inform their ongoing efforts to reopen schools? For example, recommendations around podding or spacing students as well.
Sure, and thank you for that question. We've, gotten a lot of examples that have come in, and again, thank you to all of those districts and all of those labor unions and schools that have sent in examples. We know that places like Denver, they're holding staff meetings virtually so that they are limiting the adult in-person interactions when they're not specifically needed for instruction. In DC, they have a COVID operations handbook that includes, suggested classroom configurations, removing extra furniture if you don't need it, creating additional space from places in the school that are not needed for instruction or that are not typically used for instruction, making sure that there are things in collective bargaining agreements, like in Boston, that provide for masks with clear panels, like I mentioned before, for speech therapy or working with students who are deaf or hard of hearing, or English learners or reading or other world language classes. So there are a variety of examples out there. It all comes from, again, open and honest conversations and making sure that that collaboration is actually highlighted and is actually a key strategy for finding solutions. And when you find partners across the table and around your community who are willing to engage in those kinds of conversations, you find the best and most long-lasting solutions that work for the most people in the community.
Thanks, Donna. So much to learn from the work that's already happening at districts and schools. Greta, what does CDC know based on the evidence? What are some additional things that should be front and center as districts and schools continue the work of reopening?
So I mentioned those MMWR articles that were published recently, and there have been others that have been conducted. And those really, I want to emphasize that those were made possible because school districts and local public health departments collaborated with CDC to do field investigation and actually go into schools and measure the distance between students and kind of do an assessment of what ventilation improvements have happened and how many people are wearing a mask, and doing surveys with teachers to assess how masking is going well. And so that has been such a valuable set of a dialogue and collaboration, because when we can document those changes and then we can see how effective those are, it allows us to have evidence-based recommendations that we can provide to the field. One thing I want to highlight is kind of this best practice that's emerging in the community around use of cohorting. So Donna mentioned that a little bit earlier. It's this idea that schools are creating bubbles, and they can kind of set what those are. Some schools create a bubble around a particular classroom, and our MMWR article that was done in partnership with the Utah Salt Lake County schools did just that. They create these cohorts for each classroom. In Wisconsin, they used cohorts at the grade level. And what that means is that when there's a smaller distance, less than 6 feet within those cohorts, they use larger distances between cohorts, and it allows them to keep spread low.
Okay. Greta, can you remind our audience again, MMWR?
Yes, that's the Morbidity and Mortality Weekly Report. It is basically CDC's science journal. It's how we put out information and evidence, and it's available to the public, open access, and you can just do a Google search for CDC MMWR, and you'll be able to find all of those articles listed there.
Great, thank you, Greta. Donna, you spoke about this a bit earlier, but want to dig a little deeper about how districts have included stakeholder collaboration and engagement in developing their plans to implement strategies, including labor district collaboration. Can you provide a few more examples for our audience?
Sure, but I would start by saying that many of the labor management collaboration examples from across the country predated the pandemic. And for those places, for those districts, for those states, the relationship that they had pre-pandemic has helped them navigate the pandemic slightly more smoothly than perhaps other places. But it all does come back to trust, which was mentioned by Dr. Biden at the beginning of the summit. Again, the pandemic is not something that we have all experienced before. And when you have problems and challenges that you have to navigate, particularly like this, where it's a system-wide issue, the strongest way to find solutions in that space is to collaborate, which does not mean you agree about every single thing. It means that you actually commit to working through it together, learning together, particularly in this space, and finding solutions that work for the majority of the folks who are impacted, particularly those who are most impacted by the decisions that come out. So there's been, a long history of labor management collaboration in places like Illinois, California, New Jersey, many other places across the country. And you heard about some of that earlier today, particularly out of New York City and other places where it's just, it's the way people do business. It is not just because of the pandemic. It's because they know that when they have challenges or when they have successes, quite frankly, that they want to be in it together, because that is the best way forward for students, not just the adults in the system, but most importantly for students. Because you've got all the different lenses at the table, you're taking into account different stakeholder views. And when you find solutions together, you can always make it work together. So it's got evidence behind it, and it has been proven to work.
Thank you, Donna. I think it's an important reminder that as much as we are looking to creative and innovative ways that districts have been approaching this work, there's also a lot of things that we should be leaning into that existed prior and building on those strengths. So thanks for raising that point. Greta, if a school implements the CDC recommended prevention strategies, does that eliminate the risk for COVID-19 among students, families, and staff?
So unfortunately, there's no way to fully eliminate risk of at least one case being introduced into the school, right? So especially in areas where there's a lot of community spread, there is a potential that that infection will be introduced in the school community. What the objective should be is to keep that spread low. So we really want to encourage schools to implement those 5 prevention strategies so that they can keep the one case from turning into 5 cases and 20 cases in the matter of only a few short days. We've seen that that's definitely possible.
Donna, this is a big question, but can you share more about how schools can ensure equity is embedded throughout their approaches to reopening?
Yes, that is a big question. So I'd say first, start with who will be most impacted by your decisions. Create equity checkpoints throughout your existing decision-making processes. And start with the knowledge and belief that every child, every family, every educator brings assets to your school community, and make your decisions based on those facts. But again, I'm stressing that the voice of those most impacted need to be at the decision-making tables. Is it students of color, students with disabilities, students experiencing homelessness, students without broadband access at home or the devices? Is it the paraprofessionals? Is it the bus drivers, the school secretaries? Making decisions about who you're prioritizing for in-person instruction first. Who actually needs it first? And do those answers match? Having some internal conversations among folks inside of the school community about making sure that the need actually matches the decisions before decisions are rolled out, before they become public, is going to be key here. And making sure, if you haven't already done this, making sure that equity is the first lens through which you view a challenge and serves as the foundation for those solutions instead of the last lens. Because if it's the last lens, it's going to require you to retrofit equitable supports into your solutions that you've already decided upon.
Thank you. Donna, building on that, how can teachers and schools ensure compliance with FERPA, especially with students who experience homelessness and unaccompanied minors? Did I break out? Did I break up a bit?
I think one of us did. I'm sorry.
It froze. Okay, sorry. You'd spoken specifically about students experiencing homelessness. So related question, how can teachers and schools ensure compliance with FERPA, especially with students who are experiencing homelessness and unaccompanied minors?
Yes. So FERPA must always be interpreted in terms of the statute when you consider the privacy for students experiencing homelessness. And it's the McKinney-Vento Act. And schools cannot disclose information about students' homelessness. They have to have prior written consent to release any information about a student's record. Luckily, the American Rescue Plans includes an additional $800 million that is specifically designated for identifying and supporting students who are experiencing homelessness. And these additional funds will be critical in meeting their needs. Particularly this year where so many remain not only under-identified, but also underserved. So FERPA is one of the things that we have to take into account when we're trying to support students, particularly students who are experiencing homelessness, and making sure that we're actually supporting them in ways that also preserves their privacy.
Great, thank you. So we have about 2 or 3 more questions. I'm going to try and get in as many as I can. Donna, another one for you. What if schools don't have the resources to reopen using the recommended prevention measures?
So I believe Greta touched on this a little earlier. One of the things that's that we've heard a lot from the examples that have been submitted, and actually heard from the folks who talked earlier during the earlier panels, schools and educators and school leaders are going to do the best that they can. There are a list of recommended mitigation measures or mitigation strategies that are in the CDC's operational guidance. And one of the things that the CDC has stressed repeatedly, and as I'm sure Greta will clean this up if I misspeak, is that people need to do the best that they can. There are schools that have been open since the pandemic started. They have been safe. They have taken measures to make sure that not only students, but educators and their families are safe. And there are several mitigation measures, some of which are prioritized, but making sure that schools actually pay attention to what they are putting in their plans, making sure that they are partnering with their local health district or health officials to make sure that if community health data changes or the community health context changes, that they actually have plans in place already for the school system so that they can adjust and that they aren't having to have all of those conversations in the midst of that adjustment, but that they actually have those conversations ahead of time. So I will turn it over to my colleague Greta to share more on that.
I think that was a great start. And what I would also add is that a lot of the recommended prevention strategies are actually relatively low cost or no cost, right? So I think one example, and a great example we heard from some of the districts earlier, is creating one-way hallways, right? And thinking creatively about the use of space. It also is things that are low cost, like having masks available and other, and as I mentioned, ventilation strategies that can kind of layer together to increase airflow and air exchange. So I think it's, when I go back to what my colleague Donna mentioned about the community working together to come up with a plan that works for the local setting. And there may be some things that are more resource intensive, but I also would not discount the things that are less resource intensive, because we've seen through study after study after study how effective masks can be, and they can also be very cost effective as well.
Thank you both. And Greta, related to that, are there concerns, or is it wise to reopen schools with multiple variants of the virus that caused COVID-19 detected in the US?
Yeah. So, CDC is concerned about the variants, and several of the new novel variants do seem to spread more quickly than some of the other variants we have seen before. The one thing that we want to underscore, though, is that those prevention strategies that we have been talking about and promoting and saying are effective at preventing spread of SARS-CoV-2 infection are effective for the novel variants as well, right? The masks are just as effective against the variants as they are against the wild type virus, as is distancing, and especially at this time, given the variants, we want to emphasize the importance of layering those prevention strategies. So now more than ever, we really want to emphasize using prevention, layering those strategies, and giving those vaccines a chance to get into people's arms and being effective.
Great, thanks. This might be the last question, but have you heard or seen about sports or other extracurricular activities in schools? What have you heard about that, safe ways to do that, especially as we plan ahead around summer learning and enrichment activities? What are safe ways to provide students with these opportunities?
So we actually have heard a lot about sports and extracurriculars. And, we're still learning about it. And so there are ways to do things safely. Even if you are following the CDC guidance, which we would highly recommend and stress, you can exercise outside, you can have band outside, you can have, use the space in the auditorium, and particularly in high schools that may not be used during the school day, and spread students out so that you have space to do things where they don't need to be as close. You can sing with a mask on, you can do all sorts of things. People just need to think about how to do things in a way that perhaps doesn't look familiar, but students and educators can still get the benefit of engaging in the activity as long as they do it safely and follow the guidance.
Greta?
So I think the only thing I would add is I think schools that are thinking very creatively and strategically are leading the way, right? And as always, those core principles that apply across settings. Outside is better than inside. Large, well-ventilated spaces are better than closed-in spaces that are not well-ventilated. Masking is better than not masking. And so kind of prioritizing you know, the safe sports, the ability to use prevention with sports first, and kind of getting some experience with how to do it well is a great way for schools to kind of really rethink how they're doing sports and extracurricular activities.
I want to thank you both very much for answering so many questions and for engaging in this panel. And I'd like to let the audience know that we'll be back shortly with our next discussion and a special message from the Vice President.
In these uncertain times, the future of our entire public education system is at stake. This crisis has exposed the deepest racial and social inequalities in our society, and we need every educator to join our movement. Together, we can ensure that all students, regardless of race, class, gender identity, or expression, have the tools they need to succeed. Join us.
Teachers know that kids do best in school and in person. School is where we can best nurture, teach, and connect with our students. We just want to be safe. That's why the AFT has been working to safely reopen schools since they closed, releasing our first school reopening roadmap last April. Our members want this. 88% support the AFT's science-based safety protocols, including masks, COVID testing, physical distancing, sanitizing, ventilation upgrades, and vaccine access. This roadmap creates trust and transparency and much needed equity and opportunity. Educators have been called on and have worked harder than ever during this pandemic, helping kids, turning on a dime from in-school to remote, and then remote to hybrid, and then back to in-school. They've turned their kitchen counters into chemistry labs, connected with students through postcards and porch visits, and dug deep to spark student engagement. We know school learning is best, but everyone in our community must believe that we're creating a safe environment and that our kids' social, emotional, and academic needs are met and that the supports for educators are there. So I thank Secretary Cardona for this summit on the hows, and I thank President Joe Biden for the wherewithal to get this done, prioritizing vaccines for school staff in this race between vaccine and variants, for providing more COVID testing, and of course, the whole American Rescue Plan. This legislation will change countless lives in so many ways. We, America's educators, thank you.
Oh my goodness. What a year it's been. As the principal of Ellis Middle School in Austin, Minnesota, I have the blessing of being around such incredible educators, students, families, and local community that continues to wrap their arms around us, support us, and encourage us through the heavy lift of reopening schools this year. We are so fortunate to be able to be in a space where we can say we are back to school. We're in a hybrid model, and we've had an incredible opportunity to spend time with students. One of the pieces that I think was the biggest challenge for educators and school principals was learning to lead from a computer screen. Teachers have an art and a gift and a craft and an engagement in building relationships when we're in the same spaces. And while we have done well in learning how to use these technologies, it doesn't disrupt the fact that we really appreciate being around people. There's joy in the job when we're doing it together in the same space and doing it safely. So we want to thank you for reopening schools. We want to thank you for continuing to support us as we navigate these uncharted waters. And for educators who are just in the trenches of starting to reopen, please take care of yourself. This is stressful. This is unknown. This is new navigating territory for each one of you within your districts and your prospective spaces. So please take care of yourself so then you can take care of those around you. Thank you. We hope you're well. This is Jessica Kaveen from Ellis Middle School in Austin, Minnesota.
Hi, I'm Laura Ross. I'm a middle school counselor in Gwinnett County, Georgia, where some of our students have already returned to the building this school year. What I've seen with the return of some of our students is that it's not simply a return to the building that they need. They need a lot of social and emotional supports. They need us to be intentional about reconnecting them with their peers and teachers and creating community again across the school and in each classroom. They've been greatly impacted by COVID-19 and witnessing racial injustices across our country over the past year. And so they're entering our school experiencing grief and loss, fear, anxiety, sadness, depression. And so they need to have their emotional wellness prioritized as they return to school. We want our students to be academically successful, and I think the way that we get there is creating an environment that supports their emotional well-being, that creates community for our students, so that we can hold them able to be the successful students we know that they are.
Reopen your schools as joyfully and as playfully as possible. We listened to the advice of our colleagues from all around the globe as they taught us how they reopened their schools safely, and we took the best tidbits of all of their advice. We did things like put monster footprints down in our hallway 3 feet apart to keep our children safely spaced. We have our children extend their arms in front of them and zombie walk as they pass in the hallways to keep themselves socially distanced. Our students remain in their classrooms 3 feet apart, safely spaced, and the specialists enter the classroom in a joyful way. The art cart with a bell, the music cart wrapped in lights. Our children have now been in school for over 100 days. Everyone in our schoolhouses remained safe. We've had no school closures. You can reopen your school safely. Go into your principal's office, close your eyes, and once again hear the joyful sounds of your children on the playground. You've got this.
Perseverance, dedication, collaboration. Those are all words that always match our field. Teachers have to find a way to reach each and every child. It's never been easy, but the word resilience matches this school year more than ever. This is our cafeteria, or should I say, it's a kindergarten room this year. This is one example of how people across the country have made this school year the best possible year to make sure that we're meeting the needs as best we can for all students. Students in school have materials that are their own, but so they can be socially distanced. Students at home have computers, and teachers have setups that they never thought they would have to manage, but they're getting the job done, and we are so proud.
Hi, I'm Charlie Wilson. I'm a locally elected school board member in Worthington, Ohio. I'm also president of the National School Boards Association. We here in Worthington are excited about getting back to school full time. As school board members, we know that virtually every child is much better off being in school. We are so delighted that here in Ohio, the decision when and how to go back to school was decided by locally elected school board members in their local community, doing what was best for their community and for their children. We have to, as locally elected school board members, make sure we are always cognizant of the safety of our children, of our teachers, of our staff, of our administrators, and of the entire community. So this is a glorious spring, and it's glorious to be back in school full time.
Good day to you all.
I, like so many other educators, are eager to have all of our students safely return to in-person instruction very soon. We miss them. We all have worked tirelessly to continue education during the pandemic, but I am so thankful that we can now see the light at the end of the tunnel. Our students are struggling and they need us. They need us now more than ever to listen to them and to stand ready to support their needs. Of course, they need academic support, but they also need our nods of affirmation, our confidence building conversations, and our smiles of encouragement. So many of our kids are isolated right now, struggling to deal with their fears and feelings of frustration, anxiety, sadness, and loneliness all on their own. We must create an environment where we can expeditiously and safely welcome our kids back into our schools and properly support their many needs, both social, emotional, and academic. I stand ready to do my part. Won't you join me?
Greetings, everyone. The safe reopening of schools is one of our nation's top priorities. We all know that getting our children back to school is critical for families, for communities, and for our country as a whole. That's why this summit is so important, and that's why I am so grateful that you are here. For more than a year, our parents, educators, and administrators, together with community members, have gone above and beyond the call of duty. And now that vaccines are being administered and more school doors are being opened again, we have two big tasks in front of us. One, to make sure schools and educators have the support you need to reopen safely, and two, to make sure every student is supported during this transition, including those who will need help catching up. So I want to take a minute to talk about that second task. Our students have been through so much, being away from their friends, being out of the classroom, adjusting to online learning, all while a deadly virus has threatened lives and lives have been lost, threatened jobs and jobs have been lost. And we're all worried about our students falling behind, especially those who attend schools that are underfunded and under-resourced, and especially our students who have been disproportionately impacted by the pandemic, those who are learning English, students with disabilities, students without access to broadband, students who are food insecure, and so many more. The research shows our concern is real. When the president said, "Help is on the way," he was talking about these students, their teachers, and all Americans. And now, help is here. Through the American Rescue Plan, we are providing $130 billion to help schools safely reopen and address the needs of our students. That includes $30 billion for evidence-based interventions that will help bridge the gaps in learning and meet social and emotional needs in the wake of the pandemic. The Institute of Educational Sciences has an additional $100 million to research best practices. Importantly, this bill continues to include a number of provisions to ensure that the highest poverty school districts will not lose any state funding. So here's the bottom line. A student's zip code should not determine the quality of their education, nor should it determine how well they thrive after this pandemic. You are the experts. You know what works. I know this summer you have plans to re-engage and reconnect with your students, colleagues, and communities. Please know you have our support as you engage with the innovative ideas that you continue to have to help our students. In fact, I was in Florida earlier this week, and I met with the superintendent of schools in Jacksonville, Dr. Diana Green. She talked about the challenges of continuing to feed the 130,000 students of Duval County. And again, the innovation. They set up grab bags and grab-and-go stations. They sent home what they called blessings in a backpack. And I know this is happening around the country. There, as you have been doing, they delivered breakfast, lunch, and dinner to the bus stops that normally are the school bus stops for their students. And you know, she said, even though our students are living in food deserts, our school district has been a food oasis for them. In and out of the classroom, you have provided a refuge for students across our country. The work you have done has been heroic. The work you will do at this summit is historic. Thank you again for being here, and I look forward to working with you in the days, weeks, and months ahead. Take care.
Welcome back. I'm Linda Darling-Hammond, president of the Learning Policy Institute, which has been providing research on school reopening from the very beginning of the pandemic. I'm also president of the California State Board of Education, where we've just enacted a set of additional supports for reopening schools, both to reopen schools and to continue learning into the summer. And I'm delighted to moderate this third and last panel of our day, where we're going to focus on meeting students' academic, social, and emotional needs during their return to school and beyond. As we know, the COVID-19 crisis has stretched many families to the breaking point, as many struggle with unemployment, the stresses of being confined at home, responsibility for the care and education of children, illness, and more. And young people are experiencing stress and trauma as they navigate these basic needs and health concerns and anxiety about the future. And of course, converging with all of these challenges, the pandemic has exposed racial injustice, exacerbated existing inequalities, including those in health and safety and learning opportunities and experiences. So as we return to in-person learning and into the summer and beyond, districts need to make sure that students are coming back to schools that can address this trauma, to integrate social and emotional learning throughout the day and ensure that students have equitable access to resources and supports. They'll also need to ensure that they can provide students with the kinds of academic supports that will accelerate learning without falling back into outdated approaches to labeling students for drill and kill remedial instruction in ways that ultimately undermine self-esteem and learning. We know from the science of learning and development that academic, social, and emotional learning are interrelated and reinforcing that learning is inherently social and emotional, that students learn best when they feel safe, when they find the work to be relevant and engaging, when they're able to focus their attention and they're actively involved in learning. And in our next panel, we're going to hear about 2 districts that are engaged in this work and learn about the promising strategies that they are using to address the academic, social, and emotional needs of their students. We'll learn how they're preparing staff and how they plan to use new federal funds to support student learning. We have with us today representatives from Cajon Valley Union School District, elementary and high school, located just outside of San Diego in California, and representatives from Tulsa, Oklahoma, in the heartland of the country. We're going to start by chatting with Cajon Valley's team. Cajon Valley Union is a diverse district that began working right away on reopening after schools closed last March. They operated in-service development and universal summer school in person last summer, and they've been open for hybrid in-person instruction since last fall for preschool through 8th grade. They plan to return to their pre-pandemic schedule with full-day in-person instruction 5 days per week in mid-April. And I'll introduce their team first, and then we'll go to Tulsa and introduce their team. Joining us from Cajon Valley are Karen Minshew, the assistant superintendent, Shelly Smith, who is a 1st grade teacher at Rios Computer Science Magnet School, and from Bostonia Language Academy, Principal Narelle Winter, and Anisha Ward, who is a middle school student there. Welcome, we're so thrilled to have you. And I want to jump right in, Karen, with you. In your district, Cajon Valley's prior work on academic and social emotional learning drove a reopening process that was very focused on family and student needs. And I wonder if you could describe that process and what you're now doing in offering social emotional learning experiences and supports.
Of course. Our reopening process is really tied to our district's vision and our commitment to engagement. Before the pandemic and for the last several years, we have been listening to both our internal customers, our staff, and our external customers, our students, family, and community. We actively listen. We track engagement of all of our stakeholders through Gallup. So every year we have a Gallup survey that shows us where we're hitting and missing in terms of engagement of each of these groups. We lean in a little further and learn more about how to improve. So that work was already in place. In order to have happy, engaged kids in our schools, pre or post-pandemic, we need a culture of engaged adults on our campuses. Early on, I'm going to share a little bit about our academic program because it will talk about well-being and it's tied to our social emotional learning. Early on, when we listened to our community, we talked to actual business owners locally and asking how are we doing, what's working, what's not, and they really pointed out that we in education might be stigmatizing labor and opportunities for students. They said that our focus was a little narrow and that students didn't understand the opportunities they had. They didn't understand their strengths along their career, and they were learning these things in the last several years of their schooling. So we looked at the problem, we looked at the national problem and the gap between 7 million unfilled jobs, 6 million unemployed people, and what education can do, how we can bridge that gap and bring education and the world of work together while students are with us. What we found was we needed a modern education. We created ways for students to learn about their strengths, their interests, their values, and how to align these gifts so that they understand how they can contribute to any community, their school community, their local community, including the world of work. This led us to our vision, and this has served us well in the pandemic. We wanted something simple that anybody would want for their own child. Happy kids in healthy relationships on a path to gainful employment. When the pandemic hit and schools closed, the vision was more important than ever and our need for engagement greater as well. We leaned in to our families and our students and staff. I've heard other panelists today talk about we have never engaged this much with our families, with our community. And I started running the data last night. Between listening sessions and town halls hosted by schools, hosted district-wide, we've had close to 100 listening sessions since March 13th.
Wow.
It's a lot. And when we find a new need in a different specific group, we call a meeting and we hear feedback and they tell us what their needs are. So these needs led to our reopening. It was, as people said on the call earlier, you hear things you don't want to hear sometimes. You hear hard things, but we learn and it improves the whole organization and how we can serve our students. You mentioned a lot of the steps in our reopening. It really followed Maslow's kind of hierarchy. Needs, basic needs, food. Our students had computers, which was fantastic, but giving them broad enough bandwidth to learn at home. The childcare, our learning and reopening was trying new things. The first request from the state was to open a childcare in the pandemic early for essential workers. That was the first time we tried opening and following the health guidance. You mentioned summer school in July, and now we are returning in just 2 weeks to a full pre-pandemic schedule. So with engaging our customers was the key, and that has provided us the steps and the guidance to reopen, and it's created trust with each of our groups. Modernizing education was not postponed during this pandemic, and it's critical to maintain that hope and engagement for our kids.
Yeah. One of the things that we hear from so many districts that have worked so hard is how they've really doubled down on the aspects of teaching and learning that are connective, engaging, really making new modes of communication available. Shelley, I'd like to ask you, as a first grade teacher, but also as a member of your local association, about both the new modes of communication, the town halls and everything that were opened up during that time, and the ways in which that reinforcement of the efforts towards the world of work, played out in your experience.
Well, thank you.
Yes, as Karen was discussing, we have had a lot of meetings over time. And one of my personal favorite things that have come out of all of those meetings and communication that we've had is the town hall meetings that are a collaboration between our teachers union, a teachers association, and our school district. I think it has given a great opportunity for our leaders in both areas to come together and share a common voice of what expectations are, of what we're moving towards. And then also it allows the teachers to hear the voices united. It allows the teachers to ask the questions. It allows us all to kind of get on that same page. And it's bridging a divide almost that has been in place for so long. And it's going to bring us together more, and it is building trust and laying that foundation. So I am so excited that we've had those opportunities to come together and have those town hall meetings. I think they've been vital for moving us forward. I also would love to talk about the world of work and the RIASEC. It's one of my favorite things that we have at our district.
Could you remind us what that acronym stands for?
The RIASEC?
Yes.
I will. It is. So the RIASEC is John Holland's career theory, and it's based on personality types. The RIASEC, each letter stands for something. I can tell you the same way I tell my first graders. R is for realistic, and we do a little muscle movement to show that realistic people are doers. They're full of action. They like to be outside. They like to use tools. They're very persistent. They don't give up. They keep working hard. Investigative, those are our thinkers. They like to problem solve. They like science. They investigate things. They learn a lot. Artistic people, we do a little paintbrush swoop. Those are our creators. They like to use their imagination to create ideas, things that haven't been made before. Social, those are the helpers. We do a little heart for that. Social people are helpers. They like to help other people. They listen well. They teach. They want to build those connections with other people. E is for enterprising. We do a little talking motion for that one. Those are our persuaders. They like to convince other people that their ideas are important. They like to bring everybody together, take risks, communicate ideas. And then conventional people, we kind of count on our fingers. They are very organized. They like numbers. They like math. And they like everything kind of in its place, rules and routines. So that's a little brief summary of the RIASEC.
So the RIASEC has to do with the way students are organizing themselves to think about the world of work. Is that right?
It absolutely does. And it's so absolutely focused on student interests and what they like to do. And then we take the understanding of our interests, our own personal thoughts of what we like to do, and we connect it with careers that help bridge that gap. So if I picture myself as an artist, but I only know a painter as an artist, I can learn more about other careers. Like first graders, we learn about technical writers. They have to use that creative thinking to write their information and teach other people. So it brings together our own self-interests and the work that we can do when we grow older and make that choice in our career.
And how has that helped you mobilize learning and motivate kids during the pandemic?
Oh, well, I love that the common language has given us a place to find commonalities with each other. When we were doing distance learning at the beginning of the year, I was able to have those conversations with my students, and we were finding connections of who is the same, who likes building, who likes drawing. And then also when we've come in person, we've been able to use those same understandings of each other to build our conversations through our class and our learning and our academics. I will say I'm super excited. Tomorrow, I'm going to bring all the firsties from my school to our district office. We're going on a field trip through many departments to learn about the RIASEC codes here at the district office and the work that my students could potentially see themselves doing in their future. I feel like it's given us a purpose and a common language and an excitement for making deeper connections with the people around us and building those relationships and just keeping that strong foundation.
That future focus and those relationships have been a big part of how Cajon Valley has tried to help kids stay connected. I know that, Narelle, one of the things that has gone on in the schools is creation of some new support systems for those relationships, like the advisory system that is now in place in schools. And I wonder if you could say a little bit about how the advisory system and other social emotional supports have been put in place in your school.
Well, it's an honor to be here. As a principal of a Title I school, the past year has been incredibly difficult for our students, our families, and our community. Constant uncertainty, constant changes, constant difficulty. And what we've realized throughout it all is that this has been a year for hope, a year for shifting our mindset with regards to how we approach our number one customer, our students, our families, and our community at large. We have to create relationships. We have to focus everything on the relationship. And the reality is that SEL, social emotional learning, cannot be embedded. It has to be the forefront of what you do. It has to be everything. So what we've taken is a shift in our mindset within the classroom environment. And what we've created is an advisory system. And Bostonian Language Academy is a dual language school. So we shifted the word advisory and we translated to Spanish to consejera, which translated back to English as counselor. And the role of a counselor and advisor is somebody who has deep connected relationships, not just with the students, but with their families and the community at large. We know our students, we know their strengths, we know their interests, and we know their values. And we deeply care about enabling and supporting students, regardless if they're at school or at home, regardless if they're online or somewhere else. We want to make sure that they know that we care about them and that we're able to build strong relationships with them. So as Shelley's mentioning, and as Karen was mentioning, everything throughout this year has been built on strong, positive relationships and has been built on trust. When we think about trust, it comes through conversations, it comes through time spent with our families and time spent with our students and the community at large. As a principal, I've had to shift dramatically how I approach that, how I use platforms of connection and shifting regarding what my parents feel most accustomed to, what they feel most appropriate. So that as a principal means shifting to town halls that are on Facebook Live or on Instagram, using TikTok, using dances and themes and all sorts of things that are fun for our students, and allowing our parent community to really feel excited and be a part of our school. But the other component of that, if you're looking at equity, equity also comes back to opportunity and providing our parents with the opportunity to be part of our school, to have a voice, to be heard. And one thing that you can guarantee is when you talk to our parents, they know us, they care about us, and we care about them. So I think, Linda, that's the primary component of SEL, is knowing your families, knowing your students, and being able to speak to them well.
It's interesting that you've kind of adapted a new structure in the middle school, high school as well, to have these small groups of students meeting with teachers who then are also able to connect to the families in effective ways. So I want to ask Anisha, who is the main point of all of this, what has been most helpful and useful to you in the way in which the schools have been really working to bring you back and your family connected to this process of school reopening?
Thank you. Something I know for the past year, the pandemic hasn't been easy for anyone, especially for the students and me. I know something that's been supporting us and making us feel more safe and cared about and comfortable is the role of our teachers. Like Mr. Winter said, they're not only our teachers now, they're our counselors, they're our friends. We can go to them, we can talk to them. We have really strong relationships with them, and the communication is really strong there, especially with the parents. And time has been difficult, and they've been helping a lot with that. So, yeah.
Yeah. I think that all these new strategies, both in Cajon Valley and in Tulsa, where we're going to shift in a moment, are aspects of what might continue, beyond the moment of the pandemic. And I wonder if you want to speak to that a little bit, Karen, just about how you're looking to the future.
Yeah, we're continuing our work with the world of work. We are looking at, the pandemic really made us focus. We have such little time, and from teachers saying, I have such little time, few minutes with my students, and really focused on priority standards in content areas, that integration of the modern curriculum to give our students the skills they need to create the lives they want to create and the careers they can aspire to. We are going to absolutely shift. We're really looking at a growth model. We want to stay away from deficit language moving forward. As you're working in leadership, you hear learning loss mitigation, terms like this, deficit, the pandemic, all these negative, heavy words. And someone else in the highlights video was saying, bring joy, bring light, bring growth. This is opportunity. Our summer school programs are growth programs. We are looking at growth data, and that's our local metric. We want to expand that. How can we help students grow? I want to hear about what I'm strong at, what I'm good at, and how I can grow and move away from the negative language pre-pandemic or during. We want to maintain those strategies. We also want to shift professional development moving forward. Professional development could not take place as we used to do it, and I think we were ineffective in that. So we really want to personalize and use some of our funding that's coming from the state and federal revenues to allow program specialists to really stay and stick and learn about a school and who they are, their community, what they need, and what their challenges are, and be more thoughtful and intentional with our professional learning.
That's awesome. I know that Tulsa also is thinking about what's going on now and all the adaptations that they've made with this eye to the future as well. And so I want to introduce the folks who are with us from Tulsa. We're going to say a little bit more about the back to school process, the social and emotional supports, and then I'm going to ask everyone to think ahead academically in the last half of this panel. So Tulsa is a district that has over 80 schools serving a diverse student body of 32,000 students from preschool to high school. The K-6 students have been in hybrid learning since the end of November, and then middle and high school students have been in-person 4 days a week since the end of February. Tulsa's been working on a social and emotional and out of school time initiative since 2016. So they're building on a lot of work that's going on, but also innovating in ways that will take them into the future. Joining us from Tulsa are Superintendent Dr. Deborah Gist, Deputy Superintendent Paula Shannon, Chief Learning Officer Dr. Ebony Johnson, and Gianna Alexis, 11th grader at Will Rogers College High School, and we know her by Gigi. And so welcome to all of you. We're thrilled to have you here. And I wonder if we could start off, Deborah, with your description of Tulsa's journey in this process since the schools were closed last March, both in terms of reopening, but also in terms of the ways in which you've been working with families and the community to make that loving and possible.
Thank you so much. Well, this has been such a great day of listening and learning from colleagues across the country. I want to thank you, Dr. Darling Hammond. Really great to be with you again. And I know that educators and families across the country, like us, had their world change a year ago. And you know, for us, we remained committed from that moment last year when we went into distance learning unexpectedly and really within just a few hours. We remained committed to making sure our students and our team members and all of their families were safe. And when we described safe, we meant, of course, from a COVID perspective, but we also meant emotionally safe and mentally safe and safe in many other ways. We also wanted to make sure we were focused on ensuring that we continued a high quality learning experience for our students, no matter what form that took. And we were committed to getting our students back to in-person learning as soon as we could possibly do so safely. And so throughout the pandemic, we've been committed to being data-wise and science-informed, and we've been working really closely with medical professionals and reading every study and following every release and every report, the data that was coming out both locally, nationally, and internationally. And like many of our colleagues across the country, and I know they'll feel this as being so familiar, we spent the whole summer not only serving students, but also planning for a return to school in the fall. And we designed an in-person model, a hybrid model, as well as a distance learning model. And we also, of course, stood up a virtual academy like many districts, and we had thousands of students enroll in that within just a matter of a few weeks. We honestly imagined that hybrid learning would be the worst case scenario. What we realized is, I know others felt these same excruciating decisions and these seemingly impossible choices of figuring out how to serve students, but also keep people safe at the same time. And what we found in August was that due to our level of cases and the case levels we were experiencing in our community, and with all of the advice and guidance that we were receiving at the local level, but also at the state and national level, that we needed to begin our school year in distance learning. There was concern that schools would be super spreader events, particularly in Oklahoma, where we're short-staffed in so many different positions and where we have really overcrowded classrooms. And for us in Tulsa, where we serve primarily Latino and Black students, and where most of our students are low income, that we had a particular responsibility to making sure that we were keeping our students and our team members and all of their families safe. And then we learned in the fall that due to all the safety precautions that were happening in schools that were open, and those layered protections that we've been hearing about today. And we had those in place, like many others. We had universal masking, we had high quality ventilation, we had new transition and other procedures in our schools. And we also had COVID screening testing going on, and had that in place in collaboration with our health department. So we learned that because of those kinds of things, that we could actually open our schools for in-person learning safely. And we began making that transition in the fall once we knew that. Unfortunately, our cases skyrocketed, and at that time, Oklahoma had one of the highest COVID rates in the world. And so we had to move back to distance learning. But now, as you indicated, Dr. Darling Hammond, we are back to school fully in person 4 days a week, and that has been going well for the last few weeks. And so where we are right now as a community is that we're in the depths of preparing for the remainder of this school year, for our summer learning, and for the coming school year. And we're thinking critically about all of the things that we need to do differently. We want to make sure that we are designing better, bolder systems of learning, better systems of support, the kind of experiences we want our children to happen. We want to transform those. Honestly, we know that in so many ways that schools across the country weren't working for most of our students even before this crisis. And the pandemic highlighted and exacerbated challenges and inequities, but it didn't really create them. And so we've learned so much through this, and we're deeply committed to taking those lessons while we move into this phase of supporting our students through moving out of this moment, but keeping that transformation at the forefront.
Yeah, I think that's so exciting, because I do think we're going to see schools, coming into this summer and fall that reinvent so many of the ways that we have been operating since the last round of school design 100 years ago. So I know you've been involved in that work over your career, and it's exciting to think about where it will head. And I want to ask Gigi, now you've been through all of this, to tell us a little about your experiences and your classmates' experiences during the last year, both in distance learning, and then now that you're able to be back, what you think the schools need to be doing to support you and your colleagues.
Hi, thank you for having me. I would say in the beginning, right after it all started, we went into spring break and thinking everything was normal, didn't realize that was the last day we were going to be in school in person for that year. And honestly, it was really stressful having to learn how to navigate different new platforms, having to learn how to use Canvas in a whole nother way. It was hard. And then coming into the next school year, having to be in distance learning, I myself going to Tulsa Tech, having to get from Tech back to my house and having to participate in Zooms with it while I was in transit. It was definitely hard. But once we got back in person, I definitely think it was a lot easier. It was really helpful for the students who were struggling in their classrooms with grades and attendance and keeping up. I definitely think that it helped with student and teacher relationships, not being able to walk up to your teacher's desk and say, hey, I have a question on this, or hey, can you help me with this? It definitely brought us back together.
Yeah, that is great. Ebony, I know that the work in Tulsa has also included wellness teams to support staff so that they're ready to work with students. I wonder if you could tell us a little about the wellness teams.
Absolutely. Thank you, Linda. And, to Gigi's point, we knew that our students were struggling. We knew that this was not only difficult for our young people, but it was difficult for our families and our teachers and staff members. And so in order to connect with our students and families and our staff members, this fall, we launched our wellness teams, which wellness teams in each school could consist of an attendance clerk and a social worker, a parent facilitator, a school administrator. The wellness teams were designed in order to meet the technological, the social, the emotional, the attendance, the health needs of our students, and to also just ensure that we just took care of the whole child. And we made sure that any needs that they had and any needs that the adults had in our buildings, that we were very matter of fact about supporting both the students and the adults. What we did is we took an opportunity to directly connect to our adults and our students. So we made direct phone calls. We took surveys and asked the adults how they were doing and how are the students doing. And so we tracked that information in what we called our wellness data tracker. And so on a very consistent basis, we use that data in order to truly mobilize resources and supports for our students and our families and our staff members.
Awesome. So Paula, I want to ask you, I know that educators in Tulsa have been studying the science of learning and development to inform all of your work. And I wonder if you can talk to us about how that has informed the reopening school strategies in Tulsa, but also I know you're planning for a back to school summer that will be really innovative and supportive. So please tell us about that.
Absolutely. It's my favorite topic.
I know.
We've been very intentional. Our educators who work in our district leadership teams and our school leadership teams in being intentional in our focus on social and emotional well-being as a lever for equity. So as you said earlier, Dr. Darling-Hammond, you can't have cognitive work happening without a real focus on the social and emotional well-being and skills of students. So we really started there knowing that our school experience needed to meet students where they were and that we need to do work that is highly relational and create those safe, supportive learning environments. As a district, we've partnered with Turnaround for Children for a few years now, as well as CASEL. So we're grounded in the Turnaround's pillars for reentry. So we really were focusing on relationships, on routines. Our routines were heavily focused on safety, both creating physical safety as well as that psychological safety that students need, and resilience. Turnaround has been providing monthly professional development opportunities for our educators related to those pillars. In addition to that, we've been working for a number of years, and I think we'll talk about that here in a minute, through some work that was funded by the Wallace Foundation. So we have a big partnership there. It allowed us to really partner with CASEL. So all of the work we do around social emotional learning is grounded back in the CASEL framework and their core competencies. We've leveraged that to introduce 3 key signature practices of social emotional well-being as a district. So this is something we started on a smaller scale in previous years. This year, we pushed out system-wide and really focused on warm welcomes. So all of us do that, from the superintendent opening up cabinet meetings to how teachers launch their lessons. We have warm welcomes where we really begin to engage kiddos and help students connect with one another and adults, and try to ground those things in the relevant content that we're about to discuss. It's harder than you might think. And we also have been focused on optimistic closures. So how do you close out a lesson? How do you close out a meeting in a way that allows people to be reflective about what they learned and what their next steps will be to own that learning? We've been providing monthly opportunities for our educators to take small, bite-sized learning journey with the key signature practices, and then we've aligned a set of look-fors. So the training we do with our school leaders aligns with the training we're doing with our teachers. We have a set of look-fors that we ask our school leaders to go out and observe through that lens, to then provide the kind of observation, coaching, and feedback that our teachers need to continue to grow and develop. So we're in the early stages of really bringing that to life. You know, as you learn more and create more common language, you realize how much more you can do to improve and move forward together. And then this year, we had to do all kinds of things to our school calendar, and we extended our days to make things work. That allowed us to give 30 extra minutes a day at our secondary level to dedicated advisory time on Monday, Tuesday, Thursday, Friday. Students were both in distance and have come back in person. So we've done a lot of work to gain some ground on the advisory front, doing very similar things to the district that spoke before us. And then finally, I think that I would be remiss to leave out the focus we've had on providing grounding for our educators and a focus on productive instructional strategies that really connect and engage students. And again, I think as we get better at looking for those engaging strategies within the content of meaningful, rigorous, relevant content, it helps us understand the kind of growth opportunities we have to support our educators in better engaging students through discussion as a primary form of meaning making. That's where we're really focused right now.
Terrific. So Karen, I want to come back to Cajon Valley and pick up that same thread and ask about your plans for the summer and beyond. I know last summer, Cajon Valley held Camp Cajon for about 6,000 of your students using CARES Act funds. And I know that you talk about hope and engagement rather than learning loss as the organizers for your work, which really reminds me of Paula's frame as well for the way that Tulsa's approaching this. So can you tell us a little about how you're going to structure learning this summer and into next year with these goals in mind?
Yeah, I'll talk about summer first. Definitely the feel of last summer fun. Last summer, we were learning how to do school in a pandemic. This summer, we have those skills. It is focused on, we don't want to lose the fun. We call it Camp Cajon because we want it to feel like the summer camp you went to possibly one day. And if you've never been to one, we want you to have that feel as a student coming in. That's your experience. The academic piece, we're going to focus on being very strategic on grade level priority standards that we can see in our data have been lacking this year. Teachers will be providing units. We'll have sample units for them, engaging units around the world of work that help students demonstrate mastery in a progression towards a competency or a standard. We want students to understand what their targets are more, empower them more to show, I can demonstrate this and show evidence of learning. We're really moving towards more of that competency and the growth model. We have our diagnostic on where students really are right now, regardless of how far you are from grade level, and where we can meet them during summer school, after school, the following year, and anytime outside the day. We want to balance two things. I know people say, we've been on technology so long, we just want to do all face-to-face activity, be outside, interact. Yes, yes, yes. And we also know that for our staff to pull small groups and provide that personalized instruction, the remainder of the class has to be doing something. So we are spending our time developing and teaching our staff our tool Beable. It holds our modern curriculum. That allows students to take the RISEC assessment, tell them what their interests are, show it, and it provides us the data. And it shows us the careers they're interested in while we're not meeting with them face-to-face. That gives us more data to provide lessons. Students are getting reading opportunities around careers, but it's adaptive. It's based on their lexile. So we're supporting literacy and the modern curriculum. We want to balance the best of teacher time and the art and the off time when we can't be face-to-face.
So Narelle, as you think about the work that you're doing, as so much of this has been around helping students have this project-based experience and future-oriented frame of mind, what would you say has been important in keeping students engaged that you want to continue going into the future. And then Anisha, I'm going to come to you and ask you about what has worked for you in terms of the most exciting experiences you've had.
You know, Linda, at the beginning of the pandemic, a constant piece of feedback from my parents was, when are we going back to normal? That was the conversation we had constantly. What can we do to get back to normal? What would we be doing when we get back to normal? What does that look like? Throughout the pandemic, we've been shifting our practices to be focused on our students, on our families, on our community. A big part of that has been World of Work, which is our primary curriculum, thinking through not only social emotional learning, but financial literacy, as well as career development, and providing all of our students, regardless of their backgrounds, with opportunities for success. Throughout our conversations with our students, the big vocal piece has been, please let us do things that we're interested in. And so when we have conversations with our advisors, the conversation is, do you know your students? Do you care about your students? Do you have a relationship with your students? When we talk to our parents, the conversation is, have you had a conversation with us about your passions, about your strengths and interests as a family member? And then when we talk to our community, the conversation has been, what can we do differently to ensure that you as a community member have a strong voice as a part of our school? So when we think through now the conversations we're having with parents, the conversation isn't, we want to go back to the normal, but rather it's what can we continue to do what we're doing now, because they really do love it. And I think this is the idea as we move forward into where education can be. This was a year for change. It was a year for dynamic hope to be brought into what we do, and as well to really start thinking about the whole student. And the student involves their parents, it involves their community, it involves their advisor. It's the whole picture and understanding who they are. So we're really excited about the future. We're really excited about where our students are. Students like Anisha are a wonderful example of just being able to know families, care about them, build relationships with them, and be able to understand exactly what do they need to be successful.
Terrific. So Anisha, tell us what has been most exciting and engaging for you.
Well, I know my advisors care about me and us, the students, and they help us get to know our interests, values, and passions. Something that's really been helping is the projects. We get to pick our own projects, and that helps with us to know what we're interested in, and helps our teachers to know also what we're interested in. So it's easy for them to talk to us, easy for them to communicate more. We research a lot, we do a lot of writing and things. I think that it's a good way for us in general.
Yeah. Do you want to talk about one that's been particularly fun for you?
Yeah, there's one that we call them design lab projects only because we work in a design lab, and we did one about the environment. So you just do your research, you read about it. And what I really, really liked about it was we've always wanted to do hands-on things. And finally, when the teachers and the principals and the staff listen to us, we say, hey, may we please, can we do hands-on things? And they're like, of course, let's do hands-on things. So we get to do experiments, to do projects, not only researching and seeing other people's points of views, but getting to learn and see our own.
That's great. It's a great thing to both be able to engage yourself. And I know you talked to me about the project you did checking out the detergents, the natural ones and the synthetic ones, and what they did to the worms that you were also watching. But you can see the relationship, between what goes on in your household and in your world and what you're doing in school. So that keeps kids dealing with all of this stress as well that, you've got to kind of overcome. I want to ask Shelley quickly, all these changes that have been described in the ways that schools are operating, both logistically, but also fundamentally around the, new teaching and learning strategies and so on. What has been most helpful to teachers in making this transition to, the new ways of operating and the expectations for the future?
I think what's been most helpful for the teachers is that we have been able to share what we're feeling. We have been able to ask questions. We've been able to share our concerns. We've been able to try things out, say it's working, say it's not working, say, could we try it this way? We've had a lot of support in being able to use our voice to try and move forward with what we're comfortable with, what the district wants us to do, and maybe find that middle ground. It hasn't been perfect. It's been a lot of growing pains all the way through the process. But I think the most important thing that's come out of it too is that we're all hearing each other's voices now. And I think that will help us move forward in an even more positive direction and will absolutely just benefit our students to the utmost, because we'll all be on the same page with that trust and that foundation of security and understanding each other and the same goal of supporting our kids.
Yeah, yeah. You know, we just heard Anisha say how important the relationship with the advisors and the teachers has been to her. And Gigi, I know that talking to you earlier, you talked a lot about relationships with your teachers as well. What are you and your friends doing now to reconnect with the teachers now that you're back in person? What's your school doing to make that, easy for you?
So a lot of us are going to the Wednesday Karen Connect. So I think that Miss Ebony Johnson is going to talk a little bit about that. But at my school, I know they have that every Wednesday. And then for us athletes, we go and on the Wednesdays or on Thursdays and it's Fridays and Tuesdays when we have 8th hour advisory. Instead of going to our various sports, we can come and stay and get help with our assignments from the counselors, or even some of the deans will pitch in and help, and kind of just, it's really just a lot of reconnecting with the students.
That is awesome. So Ebony, would you say a little about Karen Connect?
Absolutely, glad to. So in response to a need to connect with our students, to know that, that to make sure that they know that they have a place to go, to sit down with people they're familiar with, which is their teachers and the staff members, to really look at all of their needs. So what are the academic, their social, emotional, mental health needs? We launched the Karen Connect program, which is truly an opportunity for students to get all of those aforementioned supports. And the response that we received back was huge. We had teachers who were contacting us, telling us, thank you so much for allowing our students to come in, even if it's just in small groups. We wanted to lay eyes on them. We wanted to make sure that our students were okay. We received feedback from our students saying, much to Gigi's point, oh my gosh, I'm so glad I can go back into my school and get supports. While students were at Karen Connect, several things happened. Not only did they get all of those supports, but any of their nutritional needs that they had, we met those. We also made sure that students were being connected to any of the social services that they would typically receive in a traditional setting. When we were in person, just making sure that they're seeing their social worker and they're getting all of the supports that we would typically give them, in addition to making sure that they're getting all of their academics taken care of. They're able to ask questions and get the additional help that they needed. So we have continued our Karen Connect program as our students are in distance on Wednesdays, but students do have the ability to come to the sites and actually get the help that they need from their teachers and staff.
Then I just want to add that along with the academic help and things like that, I think a lot of what somebody else was saying, you also get emotional support. Sometimes during this pandemic, we have needed help with our homework and figuring out things throughout, our academic course. But sometimes just being able to come up to the school and talk to a teacher about things that are going on in your life is really helpful for a lot of students.
I think it's always helpful. And I know that some of these are things that you're going to be trying to continue into the coming school year. Paula, I think you also mentioned that you've started a virtual academy this year, in addition to all the other innovations that have gone on. Would you speak a little about that? And just as a whole, which of all of these inventions, it's been such creativity coming from educators during this time, how you're thinking about what that means for teaching, learning, and schooling, in the fall and beyond?
Absolutely. So I'm gonna start with what's happening this summer, and then I'll move into the fall. Because the summer is a springboard. So our summer is framed as Ready, Set, Summer. And summer will be a launching point for how we have an opportunity to be a partner amongst many in the city of Tulsa to design a different experience that is that our young people deserve. And so what we're starting with in the summer is a partnership with our local out of school time intermediary, the Opportunity Project, in which they're helping to coordinate the larger set of partners. So programming for our young people will start in mid-June, last through mid-August. We're taking a big lift in the month of July by offering a summer camp at each of our elementary schools and a summer academy at each of our middle and high schools. And then wrapping around that are programs through the Y, the Boys and Girls Club, Parks and Recreation, faith-based organizations will be offering summer camps as well. What we're really grounding in our part of this is a new vision, if you will, through our expanded learning strategy of what school can be. And more importantly, what the learning experience can be if we step back and understand that learning happens as much outside of four walls of a classroom as inside. And so let's tap all the assets in our community to support our most valuable resource, our young people. We're grounding our summer camps and academies, and then how that will pull into the school year in terms of after school programs to extend learning time in four core areas, four core components. First and foremost, cultivating community and belonging. Not going to say more about that because we've already talked a lot about the role of relationships and how important they are in tending to students' social emotional well-being. We want to build bolder programming together. At the heart of this is how we can leverage not only community-based partners, but parents as students' primary first teachers and educators. How are we all working together to listen to our young people, what they're telling us they want, giving them voice and choice in what we do, so they're excited about it. We want to ensure broader high quality learning. So like I said, really re-envisioning where learning happens and what counts for learning, and creating more equitable access and participation. That's really core. And then investing in the kinds of balance between the project-based experiential learning as part of bolder programming that our young people really crave, alongside the evidence-based intervention work that we know we must do to support our young people in some of the unfinished learning that they've experienced. And then finally, investing in those backbone supports for sustainability. So getting serious about the role that an out-of-school time intermediary organization plays in helping a city organize all of us together on behalf of quality programming for our young people. That's where a big chunk of our stimulus dollars will go to support the educators from the schools that are involved in this, to support the community-based partners that are stepping up to help our young people, and in some cases, investing in young people themselves through student internships for our high school students. So that is we have lots to learn. It's messy. I spent all morning with our school leaders. And I would say to all of you who are driving towards bold change, have the courage to be bold. You're going to feel a lot of tension. Lots of technical questions are going to come up that are mired in old bureaucracy. Forge ahead. Give your school leaders and teachers and community partners the cover they need to do awesome things for our young people. We can do it together if we forge ahead.
Yeah.
And that's our role as district leaders.
Thank you. I want to use that as a bridge to Dr. Gist to ask her about how you're thinking to use the funding that's coming from the America Rescue Act to support this work. I know you have a strong, as has been said, strong focus on equity in the ways in which the work unfolds. And since you have been a state superintendent before you came home to Tulsa, I wonder if you might also give us some sense of how states might support their districts in using these funds, in productive ways.
Well, I'm just so excited, and I'm so proud of Team Tulsa, who these amazing women represent. And I'm so thrilled about our new friends in Cajon Valley, who I was saying to our team, like, we've got to make sure we have the contact information for these folks. We got to work together. There's so many, really incredible connections there. So Paula talked about the City of Learning, and when we were saying earlier that our areas of focus are wellness in all the ways we've talked about it, really high quality grade level learning that's rich and rewarding and focused on real life experiences, but also investing in families, which we haven't touched on quite as much. And when we think about our investment and the use of these dollars, it is absolutely direct services to our students and our families. And supports for our teachers and our support professionals to provide that service. But it's also this overall collaboration. And as Paula described it, what we think of Tulsa as a city of learning, and she described some of the amazing, rich partners that we have here in our community. I would add, I don't think you mentioned our libraries, Gigi mentioned Tulsa Tech, our technical schools, our colleges and universities, our parks and recreation, our wonderful medical community. In collaboration with our state, and yes, I was a state chief twice over again before I came home to Tulsa, and we're so fortunate to have an awesome state superintendent, Joy Hoffmeister, here in Oklahoma, and we work closely with our state superintendent and her team. I think that what we need is both support, and we know that there's a role there to play for making sure that resources are being used effectively. These are taxpayer dollars. We believe that we are careful stewards of those dollars, and we want to make sure that all of that's going well. But there's also an opportunity for collaboration, for paying attention to local context and understanding that every community is different. And you can't have all of the same rules or all of the same expectations apply everywhere without realizing that the circumstances are different in so many different ways.
Yeah, I think that's such an important point. Everybody is doing this work from their own local context and inventing. And I think one of our biggest challenges now is to invent and share the various inventions that educators are creating all across the country. And with that, our time has flown by. I apologize that we couldn't get to all the topics we wanted to, but you've got a great glimpse, and people will come to your websites and call you up for more information about the great work that you're doing. I thank you all. And I want to reintroduce our Secretary of Education, Dr. Miguel Cardona.
Hello. Thank you. Thank you for what a great panel, great presentation. Superintendent Gist, you said something just now that really resonated. You said that in Tulsa, you want to have the contact information for the other. That's what today is about. It's about learning from one another, right? So we heard about the COVID handbook, and we have another one coming out. But let me tell you, I know as an educator myself, we learn best by listening to others who are experiencing similar situations and talking and sharing best practices. So thank you for sharing that. And Anisha, when you said they're not only our teachers, they are our counselors, they are our friends. You captured everything that the students across the country are saying. Linda, what stood out to you?
Oh, there's so much. Well, the thing that stands out to me is the degree of commitment, the degree of creativity, the inspiration that we can get as we see what people have both, encountered. Having to change your plans. Yeah. When Deborah was talking about the fact that they were all geared up and ready to open schools, and I know this happened in California as well, and the COVID rates spiked and we had to rethink. I've just been so inspired by the talent, the knowledge, the commitment, and the creativity of educators in these districts and all of the ones we've heard from today and so many else across the country.
It's been amazing. It's been amazing. Asset mentality, not deficit mentality. Thank you for reminding us. There's so much to look forward to. Wellness team. I love it. I love it. Wellness team. So, so many different things to think about. Thank you so much for your participation. Linda, you did a great job moderating. I want to thank all the district leaders, all the state leaders, the Board of Education members, educators, students, experts who joined us today, who shared their experience. I want to thank the First Lady of the United States and the Vice President of the United States for their remarks. We heard a lot of great ideas from the field. Collaboration has to be intentional. Follow the best practices that you hear from other colleagues and prioritize the social emotional well-being of our students and our staff. So many great ideas. Don't leave. I'm just a warm-up for the president. He's coming soon. Don't leave. At the education department, we're going to be your partner. You know, our job is to listen and learn as well. We will lead the process of healing together, of learning together, and of growing together as a country. That's my promise. We're going to provide resources and support. And I want to take a very quick moment to thank Scott Sargrad from the team at the Education Department, who really facilitated a lot of the logistics behind the scene to make this work today. Thank you, Scott and team. Awesome job. I'm really excited now to announce the Summer Learning and Enrichment Collaborative that we're going to be starting very soon. It's going to be a partnership with the National Governors Association and the Council of Chief State School Officers. We're going to be discussing ways to use the American Rescue Plan to provide summer programming for students and share best practices. And I'm not talking about skill and drill, none of that, none of that. Let's reimagine together what it can be. I look forward to the Summer Learning and Enrichment Collaborative. I also want to announce here that I'm going to be going on a tour to visit schools across the country to see what's working, how we can share best practices so I can listen. My job, I can do it better if I'm listening to what's happening in the field. So I look forward to that. And I learned a little while ago, just today, that thanks to the president's push, 500,000 vaccinations were provided for educators in the last week. In the last week, 500,000, that's amazing. 45 states have prioritized educator vaccinations. So I'm really proud of that progress that we're making. That's great. It's really our opportunity to reimagine education, to hit the reset button. Never in the history that we've been a part of have we been able to hit the reset button on things we know are not working in education. This is our moment. This is our moment, America. Educators are the foundation of our country, of the strength of our country. We know that. It doesn't take a pandemic to remind us of that. We know that, and we're going to move forward. We will address disparities in education. We will address the mental health needs of our students, and we will do it together. America, together, we got this.
Hi, my name is Cedric Missouri, and I am a senior at Benjamin Banneker Academic High School in Washington, D.C. When the COVID-19 pandemic started, I didn't know how it would impact my life. All of a sudden, schools were closed and all sports seasons and programs were canceled. As a senior and an athlete, that was devastating news to hear. For my mother, my sister, and I, we understood that this was our new norm, our new lives, and we had to adjust accordingly. Though we would not be able to go out as we once did, we understood that we had to make the most of the situation. We're all we have, and we had to rely on each other to get through this. After a year of virtual learning, in February, my school finally reopened to allow students like me a chance to come in for in-person learning along with their classmates and teachers. And as I finish my high school career and move on to prepare to college and study engineering, I'm happy I was able to end my time at school as I once started. And I hope that the rest of Washington, D.C. and students across the nation have the same opportunity. And now, it is my honor to introduce the 46th President of the United States of America, Mr. Joseph R. Biden, Jr.
Thank you for the introduction. And thank you, Secretary Cardona, for leading our efforts to reopen our nation's schools quickly and safely. But most of all, thanks to all of you. When many schools had to go remote learning, many of you had to go it alone. Teachers had to change everything overnight and become tech support, social workers, often while trying to take care of their own children. Administrators had to become procurement officers, making sure everyone had devices and a way to connect to the internet from home. We saw bus drivers dropping off meals instead of picking kids up. And there's been so much heroic work to help children stay connected, but it's hard. It's connected to school as well as connected to each other, which is almost as important. And now we have a partner in our administration. Getting our kids safely back in school is essential. And that's why I set a goal of reopening a majority of our K through 8 schools by my 100th day in office. That's why I directed all states and territories to make educators and other school staff eligible to receive vaccinations this month, including the bus drivers. That's why the CDC released a roadmap to safely reopen schools. And that's why the Department of Education is working closely with states and districts to help put all of that guidance into action. And I'm really proud to announce that starting today, states will begin receiving nearly $130 billion in school funding that we included in the American Rescue Plan. In fact, $81 billion of those dollars will be arriving today to those schools. So I need states to move quickly to get these resources down to the school districts and put them to work. My message is help is here. Help is here. Help is here for schools to purchase PPE, hire additional personnel like nurses, counselors, custodial staff, improve ventilation and sanitation, avoid devastating layoffs, and give students extra support. You know, help is here to help students make up for lost time and lost learning. Unless we act quickly, this pandemic could have a devastating long-term impact on our kids who've gone through this, including on their mental health. Today, I'm calling on all states, school districts, schools, community partners, to work together to ensure that all children have access to high-quality summer learning and enrichment opportunities this summer and beyond. This is essential for all students, particularly those disproportionately impacted by the pandemic, students of color, English learners, students with disabilities, homeless students, and all those who went without in-person instruction this year. The Rescue Plan provides the resources schools need to do this. To support you in your planning, Secretary Cardona will launch a Summer Learning and Enrichment Collaborative. Fancy phrase, just as you heard. I'll end today by saying this. We're depending on you. As my favorite teacher, the First Lady, often says, any nation that out-educates us is going to outcompete us. Everything our nation will be tomorrow depends on how we deliver for our young people today. You know, I want to thank you for the work you've done and the work I know you're going to be doing in the days ahead. We can do this. You know, I said some years ago that these aren't someone else's children, they're all our children. They're the kite strings that lift our national ambitions aloft. And they need that opportunity. They need eye-to-eye contact. They need to be with you in classrooms. It's critically important. I think we can do this. We have to. We have no choice. We can do this. Thank you.